Well, welcome everyone to the special Haldeman Norfolk Board of Health meeting for June 19th, 2020. I would like to remind everyone that our meetings are web streamed and televised, and for everyone here, if you could please put your phone on silent mode. I guess before we get going here, the agenda, before you are additional items of correspondence to today's agenda. Are there any other changes? Okay, seeing none, I have a motion that's been moved by Board Member Columbus and seconded by Member Huffman that the Board of Health agenda be approved with the addition of the following correspondence: Patricia Spencer, Larry Davis, Sherry Vermeesh, Linda and Ian Shaw, Hayden Dooney, and Natalie Carruthers per Andrea Plum from Learners. All those in favor? And that's carried. Are there any declarations of pecuniary interest? Okay.
Hello, I can't hear you. Can you hear me?
Yeah, if you could just hang on 1 minute, and I think they'll let
I'm
you.
here to speak, but I cannot hear you.
She's probably muted on our side.
Can we move? There we go. Okay, any declarations of pecuniary interest? No, seeing none. We have before us the Board of Health minutes from May 19th, 2020, and the open and closed Board of Health minutes from June 16th, 2020. Unless there are any errors or omissions, they will be declared as adopted, signed by the chair and county clerk, and affixed with the corporate seal. Okay. Now moving on to the deputation. We have one deputation to be heard today. A reminder to the deputation that the Board of Health procedural bylaw allows each deputation to speak for 10 minutes, and I will advise when there is 1 minute remaining. We now have Dr. Ella Haley respecting her deputation on the Section 22 order for the migrant workers. Go ahead. Can you hear us now? Dr. Haley? Ew. Okay. I mean, it's. Okay, we'll just hop over just to the communications. We'll get that done. There's a number of items of correspondence respecting the Section 22 order of migrant workers. I have a motion moved by Member Van Passen, seconded by Member Martin, that the correspondence regarding the Section 22 order migrant workers be received as information. Any discussion on that? All those in favor? And that's carried. There's nothing other than,
Shaker's update.
I think we'll probably best to hear the deputation first.
It's just on the phone.
Madam Chair, I don't see a in-camera session time here. I think we may have to go in camera. Should that have been an agenda addition or not?
I didn't realize, we can add it at the time like we did last
Okay.
week if there's some particular
Thank you.
legal advice that
Thanks.
you want to receive in camera.
Is there one that's like a speaker?
I see a microphone.
Video.
Dr. Haley,
Don't wanna
can you
interrupt
hear
the
us
meeting.
now?
Can you hear me? Okay, I'm muted.
Try to mute yourself.
Dr. Hardy, can you hear us? Can she just call in? Do we have to see her? What's that? I mean,
Ella Haley is now joining.
welcome, Dr. Haley. Can you hear us now? Dr. Haley?
Hello?
Hello. Welcome. You can hear us now?
Hello?
Can you hear us? Dr. Haley?
Try it again. Okay, we can hear 455 567 604 number. Hello?
Mr. Haley, can you hear us? Hello?
Oh, and I'm really supposed to see. I'll forward this to you. Shoot. It's frozen. It's frozen. Okay. Now my screen's phone. Ella Haley is now exiting.
Thank you, members of the Board of Health, for hearing me and all the technical glitches. Sorry about that. I am a farmer and I'm a professor, and I am a neighbor and friend of migrant farm workers. And I really feel that their voice is missing in this whole discussion. They're not here. They weren't in the hearing. They're not in your meetings. And I know some of their voices. I know the people who are translating for them, for some of the workers who are at Scotland Farm. Can you hear me okay?
We can hear you.
Okay, so I just wanted to maybe go through my letter here that I presented. Mexico is now saying that they will not send workers to farms that have had COVID positive tests. And so that's a real economic loss to a lot of farmers. Last Board of Health meeting, you talked over and over about the economic cost of the hearing and the appeal. But best practices in BC, which raises the bar for everybody, it's the precautionary principle, best practices would be to give everybody a separate hotel room and washroom and food. And so I think that I commend your medical officer of health, because I think he has followed best practices, especially when you have such a high population of migrant agricultural workers. And I heard the discussion too about cost. And basically these are residents of Norfolk County, and they really don't cost the county very much at all as far as health, except during a COVID outbreak, and there's real reasons for them being more vulnerable. I heard people saying, you know, now we have to cut health care, or we have to do some health cuts because now some of our most vulnerable people won't get some of the health resources that we would have had. But these are your residents, and these are the most vulnerable, among the most vulnerable, including, you know, people in long-term care homes and whatever. Those are your most vulnerable populations right now, and that's where the money should go. So I just wanted to go down through some of my points here. I really think that BC is doing it right, and that I think, you know, that's probably what Norfolk should have done, is gone even better than 3 per bunkhouse. It should have gone to the BC plan. There's 3 or 4 reports here that I wanted to refer to. The Migrant Workers Health Expert Working Group, and they have recommendations. There's the Migrant Alliance for Change. That very much includes the voices of workers. If you really want to hear them, and often they're afraid to speak up, if you want to hear their voices, go to that report, and you'll hear from workers. There's the report as well in the Globe and Mail, and that has voices from Norfolk County. Those are workers speaking up from Norfolk County, from Scotland Farm. So I think we need to hear these voices. And then there's a statement from my own farm organization, the National Farmers Union of Ontario. So we have a separate subcommittee. We address the inequality for migrant farm workers in Canada. And so I really think it's important. The National Farmers Union represents smaller farmers, not agribusiness. And so I think it's important that you look at the voices of other farmers in this discussion. So I just wanted to highlight some of the discussions from the Migrant Worker Health Expert Working Group. And they say what BC says, basically put the workers in quarantine, put them in hotels, give them private rooms and private washrooms, and then you reduce the risk. Just the really important need of social distancing, in the kitchen, in the bunkhouse, whatever. If we can avoid any of that risk, then it helps the whole economy. And these farms that have had COVID outbreaks wouldn't have had the outbreaks, perhaps, and wouldn't now be not having workers come, the additional workers come from Mexico. I'm going down through some points. Just the whole need for workers to have, private individual space storage for their possessions and their clothing, and hand washing stations and washrooms, that aren't shared by a whole number of workers. Just that whole need for social distancing and hygiene, it's not possible often, especially in bunkhouse situations. Just going down through my points here that you have. I know all of you have my letter. And then I wanted to go to the next report from Migrant Alliance for Change, the unheeded warnings. And I just wanted to point out that they received 109 complaints about housing conditions. And housing has often been a complaint among migrant agricultural workers. So I think we need to address it, and that's we knew, those of us who work with migrant farm workers, we knew that they were the most vulnerable. We knew you probably would have outbreaks. We knew before it ever happened. So here's a report from Migrant Alliance for Change, and they say, we received a call from workers at Scotland who told us that 40 workers were being housed in a single dorm before the outbreak with a single shower between them. Multiple workers confirmed that employers told the workers to keep working in large group settings after COVID testing had begun and before the COVID testing results were in. So, that's basically putting workers in vulnerable situations. I'm going to go down further to my highlight there about the need for workers to have PPE and to social distance. Some workers said at the Pioneer Flower Farms, where another COVID outbreak was, not in Norfolk, they were unable to social distance, and they were put to work before, they were put to work with workers from other houses. And then there's a Globe and Mail article where we talk about essential workers but expendable workers, how Canada has failed migrant workers. And here's some key points as well. After isolating, workers are often moved into bunkhouses where they share bathrooms and kitchens and climb on top of one another to get into bed. Many of the Scotland workers who are now coming back from quarantine are afraid of the working situation. They've confided in that to healthcare workers who are working with them. Then there's a point here in the Globe and Mail about Scotland, where at least 167 of 216 migrant workers have tested positive. Mexico is so concerned that the ambassador told the Globe that his country has put a pause on sending more workers. So that's an economic loss to the food system if we have this pause on workers. The federal government has the power to conduct proactive inspections of farm accommodation, but during a 6-week period at the height of the COVID pandemic, these audits stopped. They're now being done virtually. And virtual inspections are not the same as in-person inspections. Local public health units in the province typically inspect farm bunkhouses once or twice a year, but this is done before the workers arrive. An empty space looks very different from one with dozens of occupants. Advocates worry that unless enforcement and public health outreach kick into high gear, that lives and livelihoods are at stake, and that this will disrupt the food system. And here's another quote from Norfolk in the Globe and Mail. 3 Scotland workers described overcrowded living conditions, including small bedrooms with multiple sets of bunk beds, ill workers living with healthy ones, leaky toilets and showers that only ran hot water, an absence of information on how to access healthcare, and no PPE to guard against the COVID virus. We notified supervisors when people were falling ill, and they didn't do anything, says one worker. They treated us like animals. A second worker said employees were not provided with PPE, and he believes the outbreak could have been prevented if supervisors had been more responsive. I'm jumping down to my point. Advocates are calling for an increase in the enforcement of existing rules, particularly unannounced inspections, unannounced in-person inspections. In the long term, there's a call for national housing standards for migrant farm workers, greater access to open work permits, and pathways to permanent residency. And then I just wanted to close with a statement from my farm group, the National Farmers Union of Ontario. And we have we produced a report after 2 workers died in Ontario, 2 Mexican workers. More than 400 migrant farm workers have tested positive with COVID-19 in mass outbreaks across southern Ontario. It is spreading among migrant workers due to overcrowded, unsanitary housing and unsafe working conditions, and a failure to identify quickly and isolate infected workers. The National Farmers Union of Ontario is concerned that not all farmers are complying with government regulations regarding the pandemic. We worry that government inspections of farms and of migrant worker accommodations are being conducted remotely, and these will not be effective in the absence of supplies on-site inspections for verification. The NFU has a long-standing position in support of migrant workers. And finally, I wanted to thank Dr. Shankar for trying to protect the workers and the general population in Norfolk, where an outbreak could overwhelm the local healthcare system. The Scotland COVID-19 outbreak demonstrates a 20 to 30% increase in risk for migrant agriculture workers compared to the rest of Norfolk County population. We need to try harder to protect the health and lives of our neighbors and friends, the migrant agricultural workers. Thank you.
Thank you, Dr. Haley, for your deputation. Are there any questions from councillors? Councillor Columbus, or board members, sorry, Columbus.
Yes, thank you, Madam Chair. My question to Dr. Haley, first of all,
I can't hear very well.
I'll maybe repeat it for you. Or
my question, I'll try to be louder. Your last name is prefixed by doctor. Are you a medical doctor then, or can you clarify that, please?
I have just retired. I've been teaching sociology of environment and health, and environmental sociology, environment and health.
Okay, so is it a medical doctor ticket that you have or not?
I'm sorry, I can't hear.
Just wanted to clarify, is it a medical doctor graduate that you are?
I am not a medical doctor. I'm a PhD sociologist.
Okay.
I was
Thank you.
professor at Athabasca University.
And just to get it straight in my mind, you're suggesting, I believe, that the 3-person per bunkhouse rule under Section 22 would have been better off to have all the migrant farm workers in a hotel room with their own washroom. Is that, you don't support the 3-person per bunkhouse rule?
It's the best example of precautionary principle, yes.
Okay, thank you.
any further questions? Board Member Roberts.
Thank you, Board Chair Chop, and through you. My question for Dr. Ella Haley is, I'm looking for some feedback about the migratory workers' experience once they left the farm and they were engaging with our public health team. You've shared with us their experiences while they were on the farm and in the bunkhouse situation. I'd like to hear of some experiences once they were taken into the arms of public health, and maybe what their experiences were through repatriation. If you had any feedback that you could provide us, that'd be very valuable.
I'm sorry, I don't have an example. I don't have information on that. What I do have is a different version of what happened at Scotland. And so one of the health translators spoke with me today and told me basically that if the workers were sick, they just got replaced. There was no investigation. This is their version. I know there's different versions, but the workers were reporting that when they got sick at Scotland, that they were just replaced. And the supervisors discouraged them from getting health care access. And when they did finally have to call 911, or when they really were getting sick, they called BC. And from through BC and through a fellow worker, finally they got 911 health care. But the worker who helped the sick worker was afraid for even helping. So these workers are just very intimidated about medical deportation. They're afraid of speaking up. And when they did speak up, they felt they weren't heard. That's their version.
Any further questions? No. Okay. Well, thank you very much, Dr. Hardy, or Dr. Haling, my apologies, for your deputation today. We appreciate you joining us.
Thank you. Take care.
Take care. Bye-bye. Okay, I have a motion moved by Member Martin and seconded by Member Van Passen that the deputation of Dr. Ella Haley regarding Section 22 order migrant workers be received as information. All those in favor? And that's carried. Councillor Columbus, your mic is just on there. Might help.
Sorry about that.
That's okay. Moving on, I guess it'll be over to you now, Shankar, for your presentation.
I think what we need is my 18-year-old son to help me get this mic working. How's that? All right, good. So members, Madam Chop, members of the Board of Health, thank you for allowing me to speak today, and I'm happy to join you today, and I have lots of stuff to update you on as well. I'm sorry I couldn't make the last event. We've been managing a large outbreak at a farm, and as part of that outbreak, I've also had to serve as one of the physicians looking after the patients. So my apologies for not meeting with you earlier. I would always share that you have my cell phone number and you can always call me, and I will do my best to respond. And I've spoken to many of you on the phone previously as well. I wanted to give you an update on where we are with COVID-19 in this health district. And I put this slide in here because it really only takes one cough to transmit COVID-19. And we know that from the literature, but we also know that from our experiences at Haldeman and Norfolk. We've had two outbreaks, one at a nursing home and one at an agricultural enterprise, and we've learned a lot about that. And ultimately, we'll be able to share that with the broader medical community as well. Well, let's see. Is this not working? Is this the one? Right. I like the old days when you had the regular slide deck, you know, click. Ooh, and is this the pointer? Where's the pointer? That's the pointer, and that's...
This is supposed to be.
Okay. Sure, if I say next, would you kind of do that? So what is our response? It only takes one cough, and I think that's the metaphor related to COVID-19. If you go to the next slide, kindly. So it is about saving lives, and there have been 31 deaths in the health district. I think as we walk through this, I will share with you where I think we've made less people, we've helped improve the quality of life of some of the people who have been affected by the outbreak, and perhaps saved a life as well. Next slide. So this is great. So the whole core of public health practice is to identify, manage, and mitigate risk. Because unlike treating individual patients, when I treat an individual patient, all that matters is the person in front of me. And I can speak to them and give them advice, and sometimes we might have a disagreement. But the patient in a public health service is 110,000 people. And so how do we try to improve the lives of 110,000 people, which is different than improving the health of just one person? And it has its own unique set of challenges. So what are the clinical manifestations of COVID-19? Well, they're the straightforward ones: fever, cough, shortness of breath, muscle aches. Those are easy. Then you have these unusual symptoms. You have neurological symptoms like loss of smell, loss of taste, seizure, and stroke. You have gastrointestinal symptoms like nausea and vomiting. It can present in almost every different way, and we know this from the data that we already have in our health district. It impacts the elderly, it impacts the disabled, and it impacts the disadvantaged. And the test is not perfect. That's one of the challenges with COVID-19. The test is not perfect. It's not like an HIV test. If you get a positive test, you have the disease. Many times the test misses people that are sick. And I'll share that as it relates to the outbreak. And the other challenge, the other challenge is you can transmit the infection even when you don't feel sick. So it's not a simple, it's actually a very difficult problem to manage on a public health level. Normally in medicine, we have medications, diagnostic testing, surgery, all those things we don't have in COVID-19. We only have the ability to identify, isolate, and test. Next slide, kindly. So if either way, you could dim the lights just a bit, maybe. If you could believe me, this is an experimental type of imaging, but this is a normal chest x-ray. Looks pretty good. This is an x-ray of someone who has COVID-19. You can see how the lungs are completely destroyed. Not everyone who gets COVID-19 gets this severe, but we know that a few of them do. Next slide, please. So what's the current status of COVID-19 in Haldimand and Norfolk counties? Next slide. I know I've shown this type of slide before, but this is where we were before. And on our worst day, we had 21 cases. And we had some signals here that something might be going on. And then on May 29th, we had 120 cases. All in one day. In fact, for this period of time, I think we had the highest number of cases in the province of Ontario per 1,000 people. And then the number of cases has settled, and we have another little spike of cases here. And I'll explain why we have those cases spikes. This is less worrisome than this case. Next slide, please. Oh, if you could go back just for a sec, Marlene. So this is a cumulative number of cases. This is the total number of cases in the district. We're about, I think, 430. I never worry about the exact number because the numbers change a little bit every day, every hour actually. But we're at 430. Until this spike, we were in the twos. Battery's running low. Okay, next slide, please. So this is interesting. When I presented this slide earlier, you would see that most of the people who had COVID-19 were older people. But now we're seeing more people in our health district with COVID-19 in these younger age groups. Now, there's a reason for that. We have an outbreak in a farm, and in a farm there are younger people. But there's a complexity to this. When you actually look at the list of patients, and this was surprising to me, that a number of people in the farm are in their 50s and 60s, and in fact, there's one person who's 71. So the people working in the farm are not all young people, they're actually people with a broader age spectrum. Next slide, please. People always ask me about Norfolk and Haldimand County, and I'm not from Norfolk or Haldimand County, I'm from Niagara County, which is adjacent. And I have been educated a bit about the divorce, the marriage, back together. If we look at the cases, Anson Place occupies 26% of the cases. The farm cluster is 45%. Norfolk County is 11%, and Haldimand County is 18%. I ask you not to hold me accountable for the numbers because I didn't double check them before I came here, but I think these numbers are good. And if you could, next slide. The geographic distribution. So Simcoe is about 51%, Delhi is 6%, Port Dover, Port Rowan, Victoria, Waterford. So when you exclude the farm cluster, this is where we're at. We generally don't report when there are very few cases not to identify the people, but if you want to know privately, I'm happy to share that with you. Next slide. And if we look at Haldimand County, where there are 75 cases, Caledonia, Selkirk, Fisherville, Cayuga, Jarvis, Dunnville, and there's more dispersed cases. What's the message here? At least when I look at the data, the cases outside the cluster seem widely distributed throughout the health district. And next slide. You know, we anticipated welcoming perhaps 3,500 or 4,000, 4,500 workers. At this current time in the season, there are 2,400 workers in the health district, 2,215 have finished self-isolation. There are 350 isolation plans that were submitted. 97% have been approved. There are a few that are pending. The mean time between application and approval is 3.5 days. Next slide, please. So this is just a transition. It only takes one cough. And that's why we're really worried that it only takes one cough. Next slide. I need the slides, otherwise I won't be able to. It's okay. Do you want my computer? I have my computer as well.
It'll just take a while to get that up and running.
Oh, here's the PowerPoint. There you go.
That's yours, though, I think.
No, it's not mine. I didn't bring it now.
Yeah, I think that's gonna work.
All right, we're in good shape. Great, thank you. Marlene, if you could put the next slide on, that'd be great.
Is that where you
Yeah,
want to
that's great. It is.
Okay.
So how do you manage an outbreak? We actually managed 30 outbreaks last year at the health service. Now, one of the things about the public health service is, for the most part, we just try to work in the background quietly. But last year, I think we managed about 30 outbreaks. Most of the outbreaks are at institutions. Last year, we managed an outbreak at a bunkhouse with someone had chicken pox that spread to another bunkhouse. But managing outbreaks is what we do. And the first thing in an outbreak is we make sure that the people who are sick get medical care. It's the first and most important thing. And that means that we have to meet with the people, identify who's sick. We have to monitor the apparently well people for symptoms, because for some diseases, early treatment is essential. And then we have to move to the next level, which is to interview the people who are part of the outbreak to see who they transmitted the illness to. And then in COVID, all we have to is to identify, isolate, and test. And then we have to summarize the epidemiological data so that someone might learn from this the next time around. And we learned something from the chickenpox outbreak before at the bunkhouse. Next slide. So I want to share this. Our service is apolitical. Public health service, we're like policemen or judges. I'm appointed with the confirmation of the Minister of Health. We're governed by a statute, and that is what that is the authority that is left for me to work with. It was in part, the act was modified because of SARS, recognizing there are some things that are public health emergencies. And I have to serve, we serve if we think of these people as patients, there are 110,000 people in the health district that encompass Haldimand and Norfolk County. I think of it as one health district. And the number of people, the thousands of people that are migrant farm workers, are also residents of this health district. They're no different than any other constituent or person that we have to serve. The statute and the regulations require that people that are priority populations, people that are vulnerable, are more likely to be affected by health problems, have a special priority in the health district. And that's really not unusual for the public health service. There are many things that we advocate from the public health service that are not immediately popular. I have always advocated, and my colleagues, about giving out needles for people that are troubled with substance abuse. We give out naloxone to people that are to try to save lives. That's not instantly popular or obviously popular. I've advocated for decriminalization of the use of substances because I think that the criminal justice system is not the right place for them. If we took a poll, I bet you a lot of people would not support those ideas. But in a public health service, we are really obligated to try to treat all people, especially people who are vulnerable, with a special level of attention. Next slide, please. So what was our first big COVID outbreak? It was Anson Place. Anson Place is in Haldeman County. That outbreak affected both a nursing home and a retirement home. And there were 27 people that died. But we learned some lessons from that. We learned some good, really hard lessons. One of them, and this will go in our briefing book and be shared with people. We have an epidemiologist working on it right now. 23 people died in the long-term care side of it, and 4 people died in the retirement home side of it. Now, why would that be? Well, people in the nursing home are probably sicker. They're older. They had more medical problems. But there's also, does that explain the 6-fold difference in death? Probably not. Every person in the retirement home had a private room. Every single one. Whereas the people in the long-term care side of or the nursing home side, they had to share rooms and share bathrooms with other people. It's a well-established fact in infectious disease management or the control of communicable diseases that sharing a bathroom and sharing a room with somebody else is more likely to lead to transmission of illness. It's only one cough, and COVID-19 is a highly communicable disease. And I'm particularly pleased that people are wearing masks because it's one thing that we can all do to contribute to the spread. Next slide, please. So the health district recognized the risk of outbreaks in farms in March of 2020. I spoke to the board chair, and we received some racist emails from people saying we shouldn't take migrant workers. And I did write back to one fellow, and I said, no, these people are entitled to come. They just have to come safely. And that is the reason we wrote the Section 22 order. And the Section 22 order doesn't mention, it mentions many things. It mentions that the people who come here have to be enumerated so we know who they are. It mentions that they need to get food and water so they're treated properly while they're here. It mentions that when somebody gets sick, they get immediately identified, and so we can try to get help for them and also try to protect the other workers there. The Section 22 order required a lot of work of the Public Health Service. My colleague, Ms. Miranda, and we assigned a lot of staff to help get these isolation plans through quickly. Many small farmers appreciated the fact that we tried to help them, and I do get calls from farmers. They ask questions like how can they keep their staff safe. So, and when they were approved quickly. There was dialogue, but we recognized this was a problem. We recognized this was a problem 3 months before it became a problem in the media. And we did that quietly, as quietly as we could. Next. So who are the people who are affected when you have an outbreak in an agricultural enterprise? They're the migrant farm workers for sure, but they're also the employees of the farm who live in the community. And as we go down, I'll share with you what our experiences were. They're the close and household contacts of the employees living in that community, in this farm community. But there's also the broader community, including the people who are not affiliated with the farm. And if we're going to maintain a migrant farm program, if we have an outbreak, we need a migrant worker program. We need to be able to control outbreaks and make sure they don't spread beyond the farm, or try to minimize the spread beyond the institution. The next slide, please. So the outbreak at Scotland Farms, it affected 220 migrant farm workers who reside on the farm. These are approximate numbers. 189 migrant farmers ultimately tested positive. Approximately 75 employees who live off the farm were also tested. 6 of them tested positive. So these are people that probably interacted with the migrant farm workers. And these are 5 household members of these 6 employees. So these are all people in some way affiliated with the agricultural enterprise. Next slide, please. Well, what makes an outbreak at a farm different? Why is it really a tough problem? I could tell you that, I could share with you that 29 people in the health service worked on this outbreak. 1/3 of our staff went to try to manage it. Farm managers are experts at agriculture. My dad studied horticulture. He worked at the research station. He would know lots about corn, but I don't think his expertise lies in managing an infectious disease outbreak. So unlike an outbreak in a nursing home, we have to recognize the expertise of the people that work on the farm. Now, the people who work at Scott Lynn, they're experts on many things that helped us manage this outbreak. And I had to go to the farm myself. I've actually been out to the farm a number of times since the outbreak. Many of these patients don't have long-standing relationships with family physicians. In fact, none of the patients at Scotland Farms, and I bet you at many other seasonal residences, had a doctor. Unlike the rest of us, they didn't have a doctor. So the people who had to assume that responsibility were the doctors at the Delhi Family Health Center, the nurse practitioner there, and myself. Those are the three people who assumed that responsibility. The workers don't have OHIP cards. This is sort of shocking at one level, but people can come to Canada and they don't get an OHIP card. So they can't even, they probably can get health care, but not having an OHIP card is one antecedent to actually getting service. The migrant workers live on multiple sites. Some of them don't have excellent communication. Many do. And they have a requirement for translators. It's hard to find Spanish translators. We had to find 2 Spanish teachers, I think. Marlene was 2 Spanish teachers from the district. But we did find translators ultimately. And without translators, we can't really effectuate a public health management plan. Next slide. Bunkhouses are congregate settings which allow for the rapid transmission of COVID-19 because they have shared bathrooms, shared bedrooms, shared kitchens. And why are kitchens a real problem? Because when you go to the kitchen, you can't wear a mask if you're going to cook, if you're going to sit and eat with somebody. We actually know this also from the other outbreak, and we know this from the literature overall. And some bunkhouses allocate less than 100 square feet per resident. Under our current rules, and I can share the rules with you, which were updated in 2010, the minimum square feet that a bunkhouse has to have is 88 square feet. 88 square feet per person. So these are places, and this is not something this is a long-standing challenge, but they are very tight. They are very tight physical spaces. Next slide, please. So I shared some of this before. What do you have to do in a farm? I'll just go through what we did for these people. First of all, when the outbreak was declared, my colleagues at the Delhi Community Health Center, the nurses on the public health service, they evaluated the health status of the community of people who were affected. They interviewed every single person and found out if they were sick or not. Those people that were sick got treatment, and they continue to get treatment during the outbreak, and they're still getting to get treatment here. We tested all the people at the bunkhouse. Every single person at the bunkhouse got a COVID-19 test. We tested the administrative staff, the people who, that second layer. The first layer is the people at the farm. The second layer are the administrative staff that surround them, and we tested them. And then we also tested the we tested some other people as well in the community. We facilitated a plan for people to self-isolate. Why is self-isolation important? Rhetorically, if you're sick and you're coughing and you have a fever and you have chills, you want to spend those 14 days as comfortably as you can. And we were fortunate. Despite all the political pressure, we were able to get 120, not we, the farm operator was able to advocate for 120 rooms in Brantford. And I would give him credit for that because that was a struggle to get those 120 rooms. But by moving 120 people away from the farm, that allowed us to spread out all the other people, to get them to have a better chance of recovery, not having to put sick people as best as we could with healthy people or people that weren't currently sick. And we still are working on this, to formulate a safety plan to address the medical, psychological, and spiritual needs. The medical stuff, as doctors and as nurses, that's easy enough. We do that every day. The psychological, that's harder. I don't speak Spanish. I went over to speak with some of the men at one of the farmhouses, and with a translator, you could see the anguish in some of them because they've been isolated for a long time. They're far away from home. they're away from home, they don't have any family, they don't have their own doctor, they don't have someone who treats them in their own language. They're making a reduced income, and their spiritual needs. Now, I know the church has done some things to help with their spiritual needs, but they will need to have a plan for their spiritual needs. And ultimately, we have to prevent future outbreaks in farms. And so that's what happened at this outbreak. This is what we would hope would happen at any outbreak on a farm. If this happened at Walmart, the outbreak would have to be managed a little bit differently. So this is what the outbreak management team has been doing for the last 2 weeks. 7 days a week they meet. And they have 2 conference calls every day with the farm operator. And I have to share with you, the farm operator is part of the outbreak management team. We included them in this because they have to effectuate the plan as well, in part because we don't have expert knowledge of where the different areas are. In one case, we had to the farm operator had to open up an extra bunkhouse to help with trying to separate people out. So 120 hotel rooms in Brantford, opening up an extra bunkhouse, cleaning areas as best as we can. It's a multifaceted challenge. Next slide, please. So I think this is something the Board of Health and the Public Health Service can be proud of. There were people, by managing this assertively, we saved some people from getting sick. We helped some people who were sick get better earlier, to the extent that one man in the ICU, or actually now there are 1, 2, 3, there's one gentleman who's desperately ill, and he's been transferred to a university hospital. There are 2 people currently, I think, in the intensive care unit. There's one man who was in the intensive care unit who we can be proud of. He's back at his residence. And it was touch and go. I thought it was touch and go. I think, we can strictly talk of this from an epidemiological point of view. There are 220 people, 13 of them went to the hospital. That's 6.5% or 6%. But really, when you talk about the individuals, that one man, because he went to the hospital, he got the right treatment, he's back at home. He's back to his life. And he had some really not so nice looking x-rays. So in my mind, we can all be proud of the effort that the Public Health Service, and particularly the nurses and the Delhi Community Health Center put in to try to keep these people healthy. And many of them have returned to their vocation, not in the perfect way, but many have returned to their vocation. Next slide. In another life, I work with the numbers, so approximately 7% of migrant farm workers currently in Haldeman, Norfolk have tested positive for COVID-19. There are, I think, 2,253 workers. There are approximately 190 cases. That's how we get the 7%. It's about 1 in 12. There are about 250 cases in the broader community. There are 110,000 people in the district. So of the district overall, it's about 0.25%. Now, we could argue that these numbers might narrow a bit based on testing, although I don't think that's true, because we've tested 3,000 people in this district. We've spent lots of resources testing people in Haldeman and Norfolk County. So the risk to a migrant farm worker is a lot more. How much more? It's probably 10 times as much, maybe more. We can do the math, but it's a big difference. Next slide. So what are we going to do moving forward? Let's assume that all 4,200 people arrive. There are 2,250 around there who are currently here. There are another 1,000 scheduled to come. These are people, they're part of our district. They're like all other people who join us in this community. They're here for 8 months of the year. I would say they're like snowbirds in some ways. They travel to Mexico, they travel back. I've learned a lot about the lives of migrant workers in these past few weeks, but one of the things that we know is they come usually in March and April, and they leave. Some of them leave in November, December, but they're here for a good amount of time. We have to reduce the risk in the self-isolation period. This is what we do for all people returning to Canada. We need to identify outbreaks early. This happened in Anson Place and it happened here. You get a few cases one day, you get a couple, and the next day you get 10 or 20, and then suddenly the entire place goes in outbreak. We need an immediate reporting of symptoms among workers. That's something we really need. And why isn't there immediate reporting? Well, there's some things that are entirely normal. Before COVID, I might go to my clinic and not feeling 100%. I'd never go today. If you work and you're making minimum wage and you're far from your family or you're making a little amount of money, you might not want to report it. We need to have some mechanism for reporting, identifying people that are sick. We need to reduce the background risk in the broader community. This too is an important issue. We are quarantining the people in the outbreak like we'd quarantine the people at Anson Place. And I don't like using the word quarantine, but it is really what's happening. When you're at Anson Place, there are no visitors. You stay in your room, eat your meals in your room. When you're on the farm, you stay on the farm until we can get control, until we can get this outbreak declared over. But at some point, the people who work on the farm, they'll be cleared, and the farm outbreak will be over, just like Anson Place. And when that day happens, they will interact with all of the rest of the broader community. They'll go shopping, and they'll go to the grocery store, and probably dry cleaner, whatever the rest of our population does. And one way for those individuals not to get sick is to reduce background risk in the community. I don't have all the numbers here with me, but I think currently we're down to like 67. We're down to 2 digits. Our background risk in the community is low. It's not zero, but it's low. We need to be able to secure resources to manage outbreaks. There are 600 bunkhouses in the health district. There are 204 farmers who have migrant workers. There are 2,000 farmers. There are 110,000 people. And it's likely that we're going to need in another outbreak single residences such as hotel rooms. That is the most efficient way to manage an outbreak, because once there is an outbreak, we can separate people quickly. Those are healthy and those are sick. We need additional medical and nursing staff on a very short notice. We were able to call Delhi Community Health Center, and we were able to call on the nurses, but I don't know if we get an outbreak of 500 people that we'll have enough resources to manage that. And we need to be able to have psychological and spiritual support for these people. Self-isolation, especially an unplanned self-isolation, is a particularly troubling thing. It's one thing when you know you're coming back from Florida and you have to self-isolate for 2 weeks. It's another thing when you see all of your compatriots get sick and you have to self-isolate. Next slide, please. So what are the consequences of an outbreak? Well, members of the migrant farm community become sick and some are hospitalized. We know that. There's potential of transmission of illness beyond the migrant worker farm community. We know that as well, because we know the administrative team there, some of them got sick, and we know that some of their family members or people or household contacts got sick. The workers lose income and they have the inability to send funds to their families overseas. That was when I spoke to the workers, that was one of their concerns. One man in a written communication said, I have 5 people waiting for me to send money to Mexico. There's a disruption of the agricultural enterprise. The entire, it would be for the owner to comment on that, but I would say it's been disruptive. It's been disruptive for the owner. Obviously, I can't spell, but stretches healthcare resources. My kids are going to tease me about that when I get home. It stretches healthcare resources. So think of this one gentleman who's been in the ICU. Typically, an ICU stay is not 3 weeks. It's a couple of days, right? You go in, you get your treatment, you have respiratory failure. It could be longer, but it's just not the number of ICU beds used, but the length of time. And so he's been he's been transferred from the local hospital to a larger teaching hospital. This is, as a doctor, as a public health official, money is not is not my focus. There are other agencies of government to focus on the finances. But we know that that it affects the health districts moving to the next level. This affects families, businesses, and institutions. I had a woman who called me who was a hairstylist, and she told me when this closure, she said, why are some places allowed to open or not? And then she asked me, I depend on my tips. She said, I depend on the tips to make a living. And one of the reasons we didn't move last week was because we had, on the numbers, we had lots of cases, or 2 weeks ago. We're open today. If we can't manage outbreaks, or if outbreaks ultimately spread beyond the migrant family to the broader community, I think that would impede our ability to move to the next stage. So the public health service, although finances aren't our fundamental issue, this affects the families, businesses, and institutions beyond the farm. Next slide. I've been in it, not me personally, my colleagues. We've been receiving calls from a number of other government agencies asking us, what have we learned from this? What advice can we give? I would only give my advice at this time at a preliminary level because we got to do our full epidemiological assessment. But the Ministry of Food, Agriculture, and Rural Affairs, the Auditor General for the province, I think we have a call with them next week, is that right? I was on the phone with the Public Health Agency of Canada yesterday, the Integrity Services Unit of Service Canada, which is for compliance and enforcement, Ontario Health, which is the Regional Health Authority, the Ministry of Health. They've all been, they've all called, and we're meeting with them, and we're going to share what we know. One of the things I would share is that from this episode, and my colleague in Windsor, I was on the phone with him earlier today, from this episode, we might learn a lot. Windsor has 26 farms on outbreak. They have, I think, 380 cases already. They put a Section 22 order in. I think there was a month ago that he put a Section 22 order in. He amended the Section 22 order. But he too, Windsor Essex too, shares many of the same challenges we do. Next slide. I've got multiple media inquiries. I think there are lessons learned, but I think I really tried to focus on sharing what we know with the local media. But we've got, and I did speak because I thought it was important. I did speak to CTV, as you know, when this original outbreak happened, because I think there was some learnings and some things that we could share about congregate settings. But we've had multiple media inquiries about outbreaks in farms, and also about what has been our experience at Haldeman and Norfolk. I think this is one of the largest outbreaks of a farm in the country. So I want to talk about this because this is the four things that I was asked about, or would be asked about, when we talk about opening. What opens and what doesn't open is a provincial decision and not mine. It's not the health units. The province decides, and my guess is, it's not my guess, I know that they work from the epidemiological data, the number of cases, the number of people, the number of new cases, and they have four broad categories. So one is virus spread and containment. The health district, the public health service, our team, we can do something about virus spread and containment. We can identify, isolate, and test. That is one of the reasons we are very assertive about making sure people who we think might transmit the illness stay in isolation so they don't make other people sick. The general rule of thumb is if you have COVID-19, if you don't get isolated, that you can spread the disease to 2 to 4 other people, although I think that varies quite a bit. Health system capacity. The hospitals at the current time have capacity. The last time I spoke to the medical director of the hospital. So if people get sick, can the hospital handle the load? The public health system capacity, which is how well can we do contact tracing? How well can we test people? And incident tracking, this is about the management of data, how we pursue the contacts of individuals. My guess is that there will be a conference call at some point in time, and we'll have to comment on these items at some level, or at least be prepared to comment if we want to try to move to that next level. The fact that we moved to stage 2, I think the Premier has said that doesn't mean it's a one-way trip, that if things get worse, that people could go back to stage 1. So I think we have to work on all parts of this. The health system capacity, that's not within the purview of the public health service, but these other 3 items are within the purview of the public health service. Next slide. I want to share this with you. Outbreaks at agricultural enterprises have implications beyond the broader community. It's self-evident, I think, but I think it's worth stating again. And next slide, please. I'm always an optimist. You know, this has been the hardest thing. I've been in practice 30 years. I've worked in 3 jurisdictions. I've been the medical director of a hospital. I remain a professor at the medical school. I treat a lot of chronically ill people. I used to treat people with ALS. This is the hardest thing I've ever had to do. Every bit of our energy to try to control COVID-19. It's just not the medicine. It's about getting the team, the nurses, the public health inspectors, and all of them to try to reach that next level. And we have been working the staff hard. You know, 7 days a week, the office is 7 days a week, this office is still open. You know, since March 17th, the offices have been open 7 days a week trying to deal with COVID-19 related issues. So I do think this is a difficult problem, but I think together we can reach a new level of normalcy. It's not the same level of normalcy. Things will never go back. If you remember, think back to the days before when HIV started, it never goes back to exactly the way it was, but we reach a new level of normalcy, and I think that we'll reach a new level of normalcy again. So I thank you, members of Madam Chop, Board of Health Chair, and I thank all of you members of the Board of Health for giving me this time to share my perspective.
Thank you, Shanker. Any questions from the board members? Board Member Columbus.
Yes, thank you, Madam Chair. I do have 3 questions. The first one, the slide said 7% tested, 7% tested positive, was it? Is that 7% of the persons that were tested, or is that 7% of all the migrant workers that came?
Yeah. So the way, first of all, numbers always have to be interpreted in context. Otherwise, it's not good. But if you look at the numerator, there are, I think it's 190 now, Marlene, right? It was 179 on the slide. But it's about 190, and there are about 2,250. So if you divide those 2 numbers and multiply by 100, I can do the math now. It's about 7%.
Okay, thank you. Second question. It's been mentioned that why was the Port Dover Arena not used rather than the going to Brantford? I've had a lot of questions about that. I just wonder if you could shed some light on it.
Of course.
Seeing that we spent dollars equipping that place.
So if you have people that are, first of all, I think the Port Dover Arena was a wonderful idea, because when we initially rolled it out in March, we had Italy in front of us, right? And we don't remember the images of Italy where people couldn't go to the hospital under any circumstances. But in this particular case, the strategic decision is to separate people, to give them their own bathroom and their own kitchen. And because they were already identified as COVID-19 people. So the strategy was to try to give them, because when you go to the Port Dover Arena, the bathrooms and the change areas are common. If the bathrooms, and if we were unable, and this is a challenge province-wide, if you're unable to find hotel rooms, then the Port Dover Arena would have been a good fallback. It would have been a good fallback. It's not perfect. It would mean that we would have to take a different group of people over there. Now, this is a highly technical challenge, which is that you have to ideally want to separate the positive symptomatic from the positive asymptomatic from the negative symptomatic from the negative asymptomatic, and hope that people are not infecting each other. And it would have been harder at the arena. But it was still a valuable resource if we couldn't get hotel rooms for people. So that was the reason. That was the reason why we were fortunate enough to get 120 hotel rooms. And if one of our goals is to return men and women, to their vocation, they went to the hotel room for 14 days, they self-isolated. If their symptoms resolved, they could return to work at some level. And that was one of the goals. One of the goals was to try to do that and to make it time efficient. And you know, the county, I think, and Jason and Ms. Chop, I think they worked on this, and others, to try to get sort of a greeting program so that people could also serve their self-isolation period independently. But in this particular outbreak, the outbreak management team was able to find hotels, and therefore it became more efficient to get people healthy by putting them in the hotel room.
My last question at this time. I know you've been communicating with the federal government, provincial government, and other medical officers of health. Um, Is there any hope to acquire some dollars and some takeover by, say, the province on some of these outbreak issues, rather than do it just at our own health unit level?
Yeah, I've said this from the very beginning, like the self-isolation period should have been the same and managed by the federal government, so the health district would not have this responsibility. And I would continue to advocate, I have advocated for it. I spoke to PHA, the federal agency, yesterday, and I said that this should be managed in the same way as we manage the arrival of Canadians from China or from those cruise ships, because and you know that would make the health district's life better, if I could use that gratuitous word. The second issue is that I'd like to go back to working on things that might. One of the reasons I came to work in Haldeman and Norfolk County was I wanted to work on things that improve the lives of children, especially children who have mental health and substance use issues. And a lot of our time is diverted to managing the outbreak, which is what we're, in an emergency, that's what we have to do. So I hope that if the federal and provincial authorities take ownership of that, that we can shift some of our resources away from managing outbreaks. I think we're doing okay at the health district level. We have, we're able to manage this outbreak, and it's still going to require a lot of time and energy. But I think that, my goal would be hopefully that the province would, or the federal authority would take over some of these responsibilities.
Thank you for that, Doctor.
Member Martin.
Thank you, Chair Chop. Through you to Dr. Nestathari, I have two questions for you. The first, we spend a lot of time discussing the outbreak at Scotland as a means to emphasize the importance of isolation and 3 to a bunkhouse, and as did the deputation, Dr. Haley did as well. But I guess my question is, how do we correlate the two of those things? Because I understand transmission is very high and can occur in both situations. However, for me, they're two very different things. How do we leverage the outbreak, which was after isolation, although some of it I'm hearing may have occurred during, but how do we keep, for me, they're two very different topics, and I feel like we're using one to maybe leverage another. Can you provide some clarity on that?
So they're both important. There's the pre-isolation, there's the isolation period and the post-isolation period, and they're both important. During the isolation period, the goal is to boil the risk down to as low as possible so that people entering the bunkhouse have the same risk as any other community member. So that is one important goal of the isolation period. Also, the goal of limiting the number of people to 3, the one is the optimal number. There's no dispute in the science that the best way to isolate is by yourself, because if you do get sick, you're the only person affected. You have no hope of transmitting, or no chance of transmitting the virus to your bunkmates or your roommates. They are related in that way. One boils the risk down so that the people who ultimately enter the bunkhouse have the lowest risk. We know that we've had 8, is it 8 or 9? Is it 10 now? We've had 10 investigations of bunkhouse infections. One of them, the person tested positive. And that person, when they tested positive, because they were in the self-isolation period, we were able to remove that person immediately and protect the health of the other person. If there were 20 people in there, there'd be 20 more people who might have got sick from this one person. And we know from the Scotland outbreak that virtually everyone got sick ultimately. We know from Anson Place, virtually everyone got sick once there was an introduction into a congregate living. So when we take the other outbreak assessments, the test is only 80%. 1 in 5, it misses the diagnosis. So more than likely, part of my job is to manage and evaluate risk and mitigate it. We probably prevented a couple of smaller outbreaks among people in self-isolation residences. And that would have been a different situation if one person was occupying a self-isolation residence with 25 or 30 or 35 other people. Now, we know in Windsor, I spoke to the medical officer of health in Windsor, and I got his permission to say this, just disclose this. In Windsor, people were not self-isolating properly. People were, in our health district, we required that the Section 22 order required that individuals also were enumerated, and we knew who where these individuals might reside, and they were only released from self-isolation after the Public Health Service got written documentation that they weren't sick. In Windsor, one of the things that was noted was that people would be in the self-isolation residence and be working. They would be released to another farm. So you'd have a large number of people, they'd occupy a bunkhouse, they'd be self-isolating, and another owner of another agricultural enterprise they would be deployed at another agricultural enterprise. And that defeats the whole idea of a self-isolation plan. There are many reasons why there might be been an outbreak or there at Scotland Farms, and I can, if I'm permitted, I can talk about them privately, but I think that one can reasonably infer that at least one factor was a failed self-isolation period. Now, why don't people typically, there are many reasons why that could be, but one challenge we now know from our experience is that people are fearful of disclosing that they're sick during the self-isolation period and the post-isolation period. They both have consequences. If it's in the self-isolation period, someone who's sick might ultimately go into a larger bunkhouse. If it's during the post-isolation period, it's the disease or the virus makes its way into the residents and it quickly transmits among them. They both are important problems. So, I hope that I've provided some more background on that item.
So I guess the reason why there's regular discussion between the two is because they're related through a lack of transparency about illness in the isolation stage. They're connected.
Yeah, so I can always talk to sometimes I talk forever, and I'm sorry about that, but they're both important for sure. We already have an experience where someone tested positive in the self-isolation period, and if that self-isolation residence had 20 people, we might have had 20 sick people as opposed to one extra person in the self-isolation residence. British Columbia requires the self-isolation period be completed in a hotel for migrant farm workers, and the province supervises that. And that was after the outbreak, I think, at the nursery in Kelowna. I think the town was Kelowna, BC. So, I think one of the things I'm going to recommend to the federal authorities, and I have already recommended this, is that we really have to move to ultimately to a more robust self-isolation period. And when there is an outbreak, to also provide for single-level residences so people can recuperate from that.
Thank you. Through the chair, my final question to you, Dr. Nessathari, is I was wondering if you could provide some clarity on testing capabilities. We're hearing, if you could update the Board of Health, we're hearing from the province that there's this encouragement to go and get tested, go and get tested. If you feel as though you should or need to be tested, then you should. Can you comment on what that looks like for us in our health district? What's changed with testing? Is that an option that's available? Is that an option that we're able to provide to farmers with seasonal workers on site? What's the development in testing at large?
So, these next few days are going to be about the outbreak, but I think over next week, I think one of the dialogues we need to do is how can we do testing, among other things, to keep farm workers safe and to keep agricultural enterprises also functioning. I think that testing has a clear role in keeping congregate sites safe. And that would also be true for nursing homes, because we test nursing homes, which are congregate sites. And if we ever open up dormitories again, I think that's probably a valuable thing. When we test, the best, from my estimate, first of all, capacity in the district. There are 3 testing sites. There's one in Hagersville, there's one at the Delhi Community Health Center, there's one in Dunnville. There's testing that's available for symptomatic and asymptomatic people. If people want to get tested so I'm always concerned about the people that are at the highest risk for developing COVID-19, but the province has announced that they're willing to support testing for asymptomatic people. There's a hotline at the Public Health Service for asymptomatic testing. There's testing also available through the hospitals, where you can call the hospitals and get asymptomatic testing as well. So I think testing is valuable. One of the challenges now is that the volume of people testing sometimes can be more than capacity. So I think we have to think of, like, how can we build even more capacity? And that would be like one of our goals, is to try to get more people tested. But the number one way to burn out COVID-19 is to burn out our background risk. Burn out the number of people who might have COVID-19 and self-isolate them. And if we can get that down, then that lowers the risk of going to the grocery store. The other thing that I would say that would help us with the transmission of COVID-19 is that when we go into settings where you're not sure that you can stay 6 feet apart from somebody, wear a mask. Wear a mask. I think that if I were to go to a grocery store, I would wear a mask. If I were to go on public transit, I would wear a mask. Obviously, if you travel in an airplane, my daughter's flying today, wear a mask. So I think that's another strategy, I think, to try to reduce the transmission.
Further questions? Member Hoffman.
Thank you, Chair. I just wanted to get a clarification as to the involvement of our health unit with the migrant farm workers population in a typical year. Obviously, this not being a typical year. So you spoke about them being remunerated and that spoke of them being residents of Haldimand, Norfolk. So typically then like I said, in a regular year, how much involvement does the health unit have with the migrant farm worker population?
Well, I think that it's obviously a lot less than this year because we've had to, so the biggest, I think, one of the things is the public health unit historically has inspected all the bunkhouses, all the residences of migrant farm workers, and the federal authority requires that inspection prior to allowing people to embark on their travels to Canada. We also make an assessment of the water quality because many of these residences don't use municipal water, so there'd be an inspection of that. There has been some outreach and education to migrant farm workers. In my first year here, I was very interested in trying to work on expanding the access to medical care for people that who are migrant farm workers. Now, the Delhi Community Health Center has a migrant farm worker clinic, and there used to be a clinic where it was above Superstore. There's from Grand River. I've been here a year and a half. It's been one of my, obviously COVID-19 has diverted a lot of our time and energy, but I think it's an important priority. So those were the involvement. And I don't have a fulsome involvement before I started here as the medical officer of health. But there was involvement in those activities. The inspection of the bunkhouses is actually a very tiny. It's a significant number. There's 600 of those residences in the health district.
Board Member Van Passen, and then Michelle, and then Columbus.
Yes, thank you, Madam Chair. You talked before about addressing the medical, psychological, and spiritual needs of the workers, especially in the isolation period. How about any thought to the psychological state of the farmers themselves when they can't get workers up here in a timely manner and they risk losing their crops and not being able to harvest? Because the second phase, like normal, they've brought half the workers up to plant these crops and the other half are still to come. And I don't think we have a plan in place that would allow those workers to get there, especially with the phase 2 opening. We're going to lose the hotel rooms and those type of spaces. And I do have some concerns of the psychological stress on the farmers themselves. I have some concerns, the medical condition of young children in Jamaica that are going to be malnourished this year because they'll be begging on the street for food because daddy couldn't get a job in Canada this summer, or the kids in Mexico because daddy didn't get a job and aren't going to get the meals that they should have. And it affects a lot more than just Haldimand, Norfolk, and 110,000 residents. That trickle down goes a long ways, and it goes across the whole world. And sometimes I don't think that people realize how good we have it in this country compared to some other nations around the world. And I know this is the touchy subject, but on May the 19th, the last time we met as a board at a real meeting, you had, we'd mentioned how much conditions had changed since March when you initially set out the Section 22 order with the 3, and, you know, we've built capacity, we've gained some PPE, we've gained access to ventilators. You know, the weather is changing, we're much more knowledgeable about the disease itself, and you were going to come back and, you know, look at whether there was any room to amend that 3-person in a bunkhouse rule based on, you know, the factors that had changed. Now, I do concede that your life has been a little bit hectic since a major outbreak on one individual farm, and I think there was something to do with a tribunal hearing that took up a week or two. But I wondered if that update is coming, that you're willing to rethink that minimum number, or that you know, one size fits all number, or whether you're looking at other conditions still.
Well, I always look at orders every 2 weeks. I always look at them. You know, Mexico has more, when I look at this, first, the government of Canada has extended the travel ban, I think, till July 23rd. Now it's extended it. That's a signal that they think overseas travel continues to be a risk. Mexico is an endemic area for COVID-19. I think I looked at the numbers this morning, but the numbers are greater now than ever in Mexico, and the testing capacity in Mexico is smaller. There are more COVID-19 deaths and cases in Mexico than there are in Canada. So I think the risk profile for that has actually got worse and not better. To the extent that, and I got a lot of communication from people opposed to migrant workers coming here at all. In March, and I wrote, you know, and sometimes I had to speak to people on the phone, but you know, my dad was an aid worker in Bangladesh. Agriculture is a big part of them, and the remittances that, and I think you know that my dad used to work. I lived on the research station in Vineland, and we were in Bangladesh for a year, and the remittances that are sent from overseas workers to their home country are an important source of maintaining their income and the quality of their lives, and school fees and health services for their homes. So we, from the very beginning, despite it all, have articulated that migrant farm workers should come to this health district, but they should just come here in a manner that doesn't adversely affect the public health. Secondly, although we put in the Section 22 order, we also put in the resources so that the orders could be, the isolation plans could be executed in a timely manner. The public health inspectors, our guidance to them was to try to work with people so that we could get plans together. So your points are really penetrating. That there are, I worry about it too. Those remittances mean a lot. When I met with a group of farmers, a group of migrant farm workers yesterday, and then I met with them with their farm managers. It's more complicated than the average person might think, because many of the people who are the supervisors were also migrant farm workers themselves. And, they clearly are suffering because of this outbreak. I think it's worth acknowledging. We should never minimize the suffering as a doctor of any individual. Whatever suffering they have, it's their suffering and how they feel about it. It's always, the challenge of this job, which is unlike treating individual patients, is you have to balance the interest of, the 204 people who have migrant farmers, the up to 4,500 migrant farm workers will get here, and the 110,000 people in the district. And it sometimes means that you disappoint one person versus another. So I've got calls from people, using code words saying stuff, I don't want these people in my store, or I don't want to see them in the store. I got an email from one person who used pejorative text to describe a group of people who were clearly, or they were traveling in a bus and they were migrant farm workers, and they went to a retail establishment, and they asked me to, somehow curtail their access to that place. So, and for that person, I said, no. I said, These people have served their self-isolation period. I'm confident that their risk is no greater than the risk of anybody else in the health district. So it is a difficult balancing act, and it's not like something that's always easy. It's trying to balance all these competing interests. Now, I've learned a little bit more over these past few months about this, and we do talk to farms. There are many reasons why people cannot get workers. Three in a bunkhouse doesn't preclude people from using hotels or other sites of service. But Trinidad, I believe, until recently embargoed its workers from leaving the country. Jamaica had made individuals make a formal attestation that they would not come back to Jamaica for health services. When I have an email from farms, I'm happy to share it with you, that basically said that it's not as easy as just dialing people up to come, that people in their home countries aren't all that keen as they were, and it's just not that easy to identify people who want to travel. I do think that Norfolk County can be proud of this, that at least in Norfolk County, we made a plan to welcome these people with hotel rooms and provide no upfront cost. Anyone who wanted to bring a migrant farm worker, the county, and it's a testament to the people of the county and to the leadership of the county, that if you came, you didn't have to put up any upfront money, that you could go to the hotel room, the monitoring plan and the discharge plan would be effectuated by the county, and then the federal government came sometime later and offered the $1,500 subsidy for it. So I think when we'll only know how successful we were to contain COVID-19 a year from now. We'll only know a year from now. We won't know today. Some of this reflects just my judgment based on the data that we have, working with the team that we have. It's just like practicing medicine. You never really know who ultimately is going to benefit from that chest x-ray you ordered. But at the end of the day, I think the county, as difficult as this has been, the county of Norfolk has shown leadership in trying to make this plan work. We spoke in favor of migrant workers before they came. We spoke in favor of them while they were here. We tried to provide the county and the health unit devoted every resource that it had to find the translators, provide the clinical care, identify the contacts. The public health service identified people in the community that were risk for transmission and tested all of those people. So I think the response to COVID-19 as it relates to this outbreak was a good response. Was it a perfect response? No, it was not a perfect response. Could we have done a few things better? Yeah, I'd probably say a year from now, in the briefing book, we'll put all the things we could have done better. One thing I wish I had done better, and I could say this today, is that I was disappointed when the hoteling option was discontinued, but I perhaps could have chatted with the Board of Health privately and asked them to at least keep that going, because I think that would have been a real benefit. But that's a mistake. But I think overall the health district response has been good. The other thing I would say is that we can be proud of this. That most of the people that are sick, when we see the population of people that are sick, they're getting better. And I think that's a good news story.
Just to add on to that, Shanker, just to be clear, that it was discontinued because of the direction from the two farming representatives that we had put on the task force. Who was next there? Member Van Passen?
Just as a follow-up to that, it's one of the great things I respect about you, that you deal with the data, you deal with the facts, and you make medical decisions based on the data and the facts. But we're now at a situation, and I know this is a touchy item, but we were recently informed that there was a tribunal appeal by a local farmer, that the ruling from the tribunal found in favor of the farmer, and now you will be appealing that ruling from the tribunal. And I'd hate to see where, the data and the medical information and the conditions and your flexibility to adjust an isolation plan and the 3 bunkhouse rule is now going to be overruled by legal posturing on what is best for an appeal of a situation rather than what would be in the best interests of the workers, the farmers, and the community. And I'm not even sure if this is something that you'd be allowed to discuss. Maybe we could even ask Mr. Burgess whether we're crossing the line from an open session discussion to an in-camera discussion, but I don't know how to tap dance around this, but, you know, are you going to get legal advice on an appeal that'll overrule the medical advice and the conditions on how you would have normally approached adjustments to a Section 22 order?
Through the chair to the member, my suggestion is that because the matter is under appeal and you're asking for legal advice, if you could refrain the question specifically to the order or items of the order, Dr. Nessathari can answer. If it's a matter of evaluating the appeal, then I would suggest that you would go in camera for information on that.
Did you wish to move in camera? Member Columbus, you also wanted to go in camera for something, did you not?
Yes, I think we should go in camera. I'm not so certain right now. I'd like to get some more questions on the floor answered first, though.
Did you want to wait then? I'll skip, okay. Member Michele and then Member Taylor.
Thank you, Madam Chair. And I don't think my question is about specific parts of the comment that our CAO, Mr. Burgess, made, but I'm just going to ask the doctor with one of the things that we found out recently is that with regard to the appeal, and again, not speaking about any of the legal details involved with it, but we have learned that the date of the appeal hearing will be July the 29th, after which there would have to be some time for a decision. And I am wondering if that will put that it's the length of time. I'm still not exactly sure of what mind I am with regard to the actual details of the legal standing that is involved in this case. But my concern is that by the time we get to basically the first week of August, for many farmers, it will be too late for them to get their workforce in and begin their, by that time, harvesting, not planting, but harvesting. And I'm just wondering if you would agree that that will put those farmers in an even more stressful mental and physical position that I just don't think that they are going to be able to cope with.
There are 204 farmers affected by the Section 22 order. And I'm sure that they are struggling through COVID-19. I know from my dialogue with people who live in the health district that almost everyone has been affected in some way by COVID-19. As it relates to the legal issues, I'd have to ask legal counsel to comment on that. There are another 1,000 workers approved. There are 4,500 workers who came in the previous year. At the current time, there are, and I have the exact numbers here from the data group, there are 2,215 already here, of which 192 are in self-isolation. Sorry, there are 2,407 here, and there are 2,215 working. There's 192 on self-isolation. There are 351 isolation plans approved. of which or 97% of the applications have been approved. The reason their workers are not here are not related to the fact of the 3 for bunkhouse. The plans have already been approved. The farmers have got their plans, and we've approved them. There are many reasons why workers cannot come, and one of them is the embargo from home countries. Secondly, is the desire for people not to arrive. It is true that some people have to put individuals in hotels if they want to effectuate their plan or find an additional trailer, and there's an additional cost for that for sure. The federal government has recognized that and provides a $1,500 a month subsidy for that. We never diminish the suffering of any human being. You know, wherever you are in life, affluent, poor, middle income, and the struggles of people with their psychological health vary. I treat people of all income strata. But in factoring that decision, we also have to think of the health status of, in this particular case, 220 men are in some capacity, have been isolated, displaced, have become ill. 13 have gone to the hospital. 1 is desperately ill. 3 went to, 3 or 4 went to, 3 went to the intensive care unit. And those are the difficult balancing acts between this. The actions, my job is ultimately to save a life. And there's no amount of money that we can put on saving a life. And that is the way that, this is my 30th year of practice. A school teacher would never let a child leave their classroom if they couldn't help them. I work as a doctor. The actions that I have to take, and the public health service has to take, is to save a life. And we already know that by these actions, we prevented a group of people, because we have 1 self-isolation residence already where somebody turned positive, that we limited the spread of COVID-19, and if there were 30 people in that bunkhouse, we'd probably have another outbreak there. We have other outbreak investigations where people had symptoms consistent with COVID-19, and a percentage of those people, if retested or evaluated in other ways, would probably have COVID-19 as well. So I think that at one level, we can never discount the suffering of the individuals, the farmers, the enterprises that have migrant farm workers residing on their campuses. But those decisions also have to be counterbalanced by the interest of the migrant farm workers, the thousands of them who arrive, who have also protection under the statute, and the broader population. And that is the difficult balancing act that we have. I do appreciate the question, though. It weighs on my mind. At the end of the day, the statute and the rule is for me to advance the health of the community. It's not for financial reasons or economic reasons or anything else but advancing health and the health of the population. That is different than what other government agencies are charged with, which is economic development and regulation and those items. So we're just trying to do the best, the public health service and me personally, we're just trying to do the best we can on this.
Thank you, Doctor. Doctor, I'm just going to change gears a little bit with a couple of more, hopefully brief questions. Now that we are entering stage 2, is it going to be possible, perhaps, and I have had several inquiries from residents about the lack of public washroom facilities in the county. In stage 2, would we be able, through the health unit, to be able to allow for some public washroom access for people? Some of our residents who are essential workers, and I don't mean essential workers as in working for the county or for the province, but rather they are allowed to conduct their business, have asked if they can have access to washrooms. Also, it is, and there are obviously numerous hardships that everyone has been experiencing due to COVID-19, but it also affects a lot of our business communities. Retailers are hesitant to allow people to use their washrooms for fear of spread of COVID, and but which means that a lot of people don't go out and patronize those particular retailers. And if there were a few more public washrooms available, people would be able to solve that problem. So I'm hoping that that's something that you can tell us more about and what we might expect.
I'm going to let Mr. Burgess answer that question. Member Michelle, I think there's been a lot of washrooms that are actually going out in the field currently.
Yeah, thank you through the chair to the member. I never actually thought I'd ever spend so much time dealing with public washroom issues, but working with the health unit, we did develop some strategies. We closed the public washroom traditionally in the beach in Port Dover because we couldn't effectuate good social distancing because of it's a very condensed area there. But we put a substitute site in working with the Port Dover Board of Trade. We've opened up some of our other public washrooms, including some of our other fixed public washrooms. We're also deploying some of our portable washrooms that we would deploy normally during the year. But we are not deploying all the ones that we would normally deploy during the year. So we are there. There's additional cost to the county because we have to we've taken the approach of a higher than minimum standard for cleaning washrooms, so we're going to clean them more frequently, especially the high-touch ones. So they will be out there. There's some out there already, but it won't be as many. There won't be as many on trails or baseball diamonds as you'd seen in the past, but there will be some out there.
Thank you, Jason.
Thank you, and through you, I read an article today about a contact tracing app that's going to be tested first in Ontario, and I'm just wondering if you'd be able to give us an update on that. Will we have capacity in Haldeman, Norfolk, and can we expect a communication piece to go out about it?
Could you repeat just the last part of your
comment? Just can we expect a communication piece to come out about the contact tracing app?
Yeah, I was very fascinated by it. Singapore. So our contact tracing, if I could talk about this topic forever. So contact tracing is an imperfect science for sure. So somebody gets sick, they test positive for COVID-19, and then we call them up and ask them these detailed questions. Who among us would know exactly who we interacted for the 48 hours and if we spent 15 minutes with them? And so the contact tracing app, I think, is a good one because it'll help refine and perhaps automate and make it a bit better. I wanted to look into the app itself for Ontario and get some more information. And I'm happy to report back to you or to chat with you about it, but I'm very interested in this. It too is a balancing act between personal privacy, which is something we cherish, and the whole idea of identifying people who might be close contacts and putting them in self-isolation for a period of time. So, but I'm very excited by it, and I think that once I get some more information, I can call you and we can chat about it, perhaps.
Member Columbus.
Thank you, Madam Chair. I have two questions, and then I'd like to make a comment on behalf of the Ag Advisory Board. Okay. My first question here is, there's a number of, the asparagus season is pretty well complete now in the last 4 to 6 weeks. So I've had producers asking me where they normally, year after year, they transfer those workers to other farm operations. It's part of the process that's been going on since the migrant farm worker existed. So like the asparagus growers would then, workers would then go on to sweet corn or something else. Can you outline that process? Are there going to be any hiccups is what I'm getting at. Are there going to be any hiccups with respect to that process moving from farm to farm?
So I can comment on the public health part of this. Once somebody finishes their self-isolation period, they're able to move. They're able to move from farm to. They're able to move to another farm. That's not managed by the public health service. That's managed by farms, which is the Foreign Agriculture Resource Management Service, which I think is a quasi-governmental authority. So from the Public Health Service perspective, the most important thing is that we want people to be safe on their arrival, but but the actual transfer of workers from one farmer to another is not managed by the Public Health Service.
That second question here is, why not test the workers when they arrive and 12 days later during their isolation period?
No, I think as a pure, we don't set certain policies for testing. That's, I think there are a couple of challenges, and these are more strategic challenges. The real goal is to make sure that people, when they arrive, whoever they are, from Florida or from the UK or from Jamaica, that they do not transmit COVID-19 to anybody else. Now, if the test was as good as an HIV test, that would be easy, because you could test them for HIV and call it a day. But the test isn't particularly good. It misses 20% of the people. So the most effective strategy is to actually just self-isolate for 14 days. In fact, if you develop COVID-19 today, if I developed COVID-19 or Ms. Miranda did, we would test her. If she's positive, she would self-isolate for 14 days, and we never repeat the test. Because, assuming that Ms. Miranda didn't work at the Public Health Service, that is, if she worked in a regular non-healthcare occupation. So time is a good enough indicator of if you're not going to infect somebody else. And we also know this from the Anson Place data set, and I think it'll come out in the agricultural enterprise. I would not use testing as a strategy to clear people in many occupations, because many people will have a positive test but be at no risk to infect anybody else. So why would we want to? So there is a role for testing, for sure, and I'm happy to have that dialogue with people. But for me, the most effective way of keeping somebody safe and keeping the population safe is to actually just ride out the 14 days. And if you ride out the 14 days, even if you were positive at the beginning, you would have cleared it, and after those 14 days, you were at very low risk of infecting anybody else. Now, if I could add from a more programmatic, if we want to prevent outbreaks, we should move to sentinel testing. So sentinel testing means, and we do this for the flu, it's not novel, is that you take a population of people. So if there's 600 bunkhouses, you may take 5% of the bunkhouses every 3 days and test them, test a small group of people. If the test is only 80% good or 80% effective, if you test 10 of them, 10 people at that bunkhouse, and they're all negative, the chances are it's not there. And then if you do it next week or 3 days later, or you do it in some sequential way, that's a way that one can control, give an early warning system. Just hypothetically, if there were 200 cases of COVID today, the first case probably infected 2 to 4 people, and those 2 to 4 people infected another 2 to 4 people, and in that next case infected another 2 to 4 people. So this is not the most, this is a crude form of epidemiology, but there were probably multiple generations of infection. If you were able to get to the earlier stages of infection, that would mean that less people would be infected, and there'd be less residences that would be affected. So it's a valuable thing. Testing is a valuable, valuable strategy. Testing everybody in one shot only tells you what's going to happen today. And so that's not a good strategy unless you have unlimited financial resources to test everyone every day or every week, which is, and thinking of this as a practical possibility. And in the Public Health Service, we have to think of the practicalities. We've tested about, I have the numbers here, I think we've tested about, I'll give you the exact number. It's too much paper. It's a bit more than 3,000. I think Ms. Miranda would know. But it's many thousands, 3,000 to 4,000 people. If we were to test 4,500 agricultural workers every week, that would be all the people that we tested right from the, how many is it? It's 3,500. We tested approximately 3,500 people. If we tested 3,500 people over the last 3 months, how likely is it that we can that reasonably within our resource envelope test the 2407 that are currently in the district? It just won't work. And then we'll be spending all of our resources testing. The second issue, and this is a delicate issue, if we test someone, once you test someone in medicine, you have to be able to do something with the results. So we test somebody and they have a positive result. Then what? Right? If they're positive and sick, we might choose to remove them, treat their household, which would be the bunkhouse, as a cluster, self-isolate for 14 days. But if we're going to do that, then we're going to also have to find hotel rooms for perhaps 50 people, or find another venue for, a bunkhouse. Some of the bunkhouses have 90 people, a venue for that care. So it's a program that we have to think about. We have to contemplate on how we use testing to help the population. I personally believe testing is a good strategy. I would do it in a rational way, though. I'm happy to speak to people. One farmer, one owner of an agricultural enterprise did call me, and I did have a chat with them about that item.
Shaker, I think if I could jump in, Member Columbus, I think the allegation that's out there is that the health department failed the migrant workers because you did not do testing when they arrived or when they left their quarantine period. There's this belief that we should have been doing that. So perhaps you could maybe just articulate just a little more clearly that, again, we were allowed to test, especially when the test supplies were limited. As the provincial government acquired more and more testing supplies, those guidelines as to whom we were allowed to test expanded to the point now where you can have, anybody can go for a test if they so desire. But that was not the case when these workers arrived.
That's right. The testing regime, things have changed a lot in COVID-19, right? We thought it was just respiratory symptoms. We know that's not true anymore. When the testing regime is dictated by the provincial health authorities, and the testing indications at the very beginning were they had limited testing capacity and test only people who had the cardinal symptoms: shortness of breath, cough, dry cough, fever. And they've then expanded the criterion with the diagnostic, the clinical symptoms, and now there's this construct of asymptomatic testing. So that has been the change, and the recommendations of the local public health unit are concordant as it relates to self-isolation period with the provincial guidance as it relates to testing of people, migrant farm workers and other Canadians. So if you come back from Florida, you don't need to be self-isolated. You don't need to be tested before you're released from self-isolation. So I guess there are two issues. One is operationally, those were the provincial direction. Clinically, testing is not necessarily the most efficient strategy to clear people of the virus.
And the other component with that as well was in terms of the lab results. So there was a number of complaints that it was our public health department that delayed the results. Sometimes in the beginning they were taking 10 days in order to receive results back. But again, that was managed by the province through Public Health Ontario and not through our local public health unit.
That's right. So, one of the things we work at the Public Health Service is return phone calls. And in many places, we spend a lot of resources getting phone calls returned. I think Marlene can share, I think it's 8,000 phone calls now since when you get a lab test, initially the lab test went to the government laboratory in Toronto, and then they expanded testing to other labs and then to private labs. The Public Health Service doesn't manage, the local health district does not manage the lab. We're at the, we get the results when the lab will send us the results. We sometimes phone and try to get results earlier. I've been admonished for calling Toronto. I've been admonished for calling Toronto because I put some, I shared my disappointment with the delays in the labs because I expect the lab test to come back the next day. But it's been a challenge for sure about the delays in lab test results.
So, and then the third component would be now that there is increased capacity in testing in terms of not only the supplies, but the availability of labs to be able to to produce the results on all of those tests that have been done, that now, as I believe you have been consulted or are beginning consultations over some potential options for testing the workers moving forward with the provincial government.
Yeah,
And that will and just to finish, and that will necessitate working with the Ag Advisory Board to come up with a plan that's suitable to the farmers and to public health to be able to do random testing.
I've always been for it. I lived through the HIV era, test. Just test the right people. So I'm happy to talk to them about testing. I think there has to be some consensus on what we want to achieve for testing and what would happen if you had a positive test. But I'm all for it. I'd be happy to meet with anyone to talk about testing. And so, and I have talked to one farmer just earlier this week about how you might test as a large population of individuals.
Would council, go ahead, Board Member Columbus.
Yes, Madam Chair, I was wanting to make a statement on behalf of the Ag Advisory Board. Okay. So, at the Emergency Board of Health meeting last Tuesday, there was a motion passed which was moved by Councillor Van Passen, seconded by myself. It's read that the Board of Health asked the Medical Officer of Health to consult with staff, including members of the Ag Advisory Committee, to look for practical amendments to the Isolation Plan Section 22 order. So, there was an informal gathering, virtual gathering, I guess it was, with 4 members of the Ag Advisory Board, and myself, Mr. Burgess, Councillor Van Passen, and Ms. Miranda were there. And there was a great dialogue took place, a lot of conversation. I think it was about an hour and a half in total, and to foster a future commitment to work together. The one thing we determined was that no changes could be done without Dr. Nessatheri. Unfortunately, he was not at this particular gathering, and that the changes needed were not only a long-term commitment of changes, but the immediate need for changes, okay? So, the Ag Advisory Board initially thought that there would be an official meeting called this morning, Friday morning, so that we could prepare some material for this particular meeting here. However, a futile attempt of Thursday evening's informal discussion, it was felt that the Ag Advisory Board could do nothing without the Medical Officer of Health looking to make practical amendments to the requirements for isolation plans related to Section 22, which is what the motion had stated. Thursday evening's discussion, however, we discussed some best practices, and some of those are to share regarding worker housing, more support and involvement from senior levels of government, more test screening of workers pre-isolation and post-isolation. Post-isolation and community infection remains a serious issue with concerns, and need to address travel quarantine and post-travel quarantine. So those are some of the things that were discussed, and to look down the road into the future. But there's really without any movement with respect to the practical amendments that we requested, Councillor Van Passen and I, supported by the Board of Health, there's really no movement on this whole subject. So that's where it stays. Perhaps Councillor Van Passen might be able to chime in on here if he wishes to add anything else.
Thank you, Madam Chair. I think this, a lot of the farmers, they're concerned, and I touched on it before, that, they brought in half the workers. You did 330, I think, isolation plans. They found a way to make it work. Now the other half of the workers have to rise soon, and I think Councillor Michelle has already pointed out that the timelines aren't working for that. But how do I do an isolation plan when, it worked in the spring to bring half the workers, and I got 3 bunkhouses, and I could put 3 over here and 3 over here and 3 over here, and I could rent some hotel rooms. But now I've got workers in all my bunkhouses because they're all at reduced capacity because they have to meet the other conditions for isolation. So now I got no bunkhouses left. Where am I going to isolate the second round of employees that are coming in And again, if Ontario is open into phase 2, the hotel rooms are disappearing, the Long Point Eco Adventures of the world are disappearing, the trailer parks. How are we going to develop these isolation plans when there's just no space left? And that is an immediate concern. I'm sure, and the Ag Advisory Board is also, quite willing to work on this, that before next spring comes around, that the federal and provincial government and Norfolk County will have made adjustments to the entire system and the entire program, and we're already working on that, or the Ag Advisory Board is already working on that, but we also have an immediate problem of how do we make these adjustments for next week and the rest of the next month. And, again, is the federal government willing to step up the plate, the provincial government? Is the county willing to reopen sort of that discussion of the hotel plan that we would front the cost? So this is what makes life in farming a little stressful for those people.
So I'm always willing to meet with people and talk to them. Dialogue is a meaningful part of public health practice. If people need help, we've already approved plans for, and I always go back to the numbers, for another 1,000 people, I think. They're already approved. There are there are 340 plans that have been approved. As it relates to hotel rooms, we have contacts in hotel rooms, and we were able to use those contacts in the past. So I don't think if people need hotel rooms, I think we'll be able to, if the farmers can't find hotel rooms on their own, then I think that I'm willing to ask the board chair to revisit other ways to help with that. As it relates to the 3 in a bunkhouse, that is, I think, the challenge here. We cannot ask to diminish the health status of a migrant worker so that we can effectuate an improvement to the financial status of a farm. And that is the hardest part of my job. My job is, in fact, to try to balance competing things, but at the end of the day, it's the health status of the individual. That is the thing that is most important. But if there are other ways that we can help at the health unit, we will. If it relates to hotel rooms, I could, and I don't want to violate any confidences, but we do have access to hotel rooms through a whole variety of strategies. I don't think that it's consistent with our mission to diminish our objective to maintain the best possible health status for migrant farm workers, and or for anybody else for that matter. That I think that that's just something that we have to accept as a determination. But that doesn't mean that people who are struggling to find hotel rooms that we're not willing to help. And I could share with you how I know that there are resources for hotel rooms. The second is that I think that if and I don't want to speak for anyone else, but I think if farmers wanted advice about how they could organize hoteling options, I'm happy to give advice on that. We actually now have experience on how to effectuate also the monitoring plans and timely release of people returning to the workforce. I think the rate limiting step, though, for workers is the fact that in many home countries, the workers are either unavailable or don't want to travel, or their government has created other challenges from them leaving their home country. I know as it relates to the outbreak, there are at least some farm workers who want to return to their home country because they're fearful of the outbreak itself. So.
Okay, thank you. I have a Board Member Ravitz.
Thank you, Chair Chop, and through you. I have a few questions that are oddly specific, and then I have a few that are a little bit more broad and maybe a little bit more forward-looking to our future Board of Health meetings, if you'll indulge me. My first question is with regards to the use of self-assessments. There's an Ontario self-assessment tool. And I'm just wondering what, in your professional opinion, is the efficacy of using these tools and these resources. And as a follow-up to those self-assessment tools, there's individuals that are considered an at-risk group, those that suffer from chronic illness or asthma, maybe due to their age. And I was just hoping for a brief comment on these self-assessment tools that were, those of us that are back at work or have never left. It's become part of the new normal for us to be taking these daily self-assessments, to be reporting often very sensitive health-related information to our employers. Many of this is being used, on the honor system, so to speak. And I was hoping maybe also for a brief comment as to whether these tools should be proctored, or if we can rely on folks to be honest when they're taking them. What do you believe the efficacy is in a self-assessment tool?
Well, those are wonderful questions. I think it's okay to use the self-assessment instruments and tools. Self-reporting is a good mechanism to identify illness. So if we treat an individual patient, the most valuable question is how you're feeling. Not do you have a cough or chest pain, how are you feeling? Someone says, I don't feel good. So I think they're valuable for sure. As it relates to testing, I would say that if you feel that you've been exposed to COVID, have COVID-related symptoms, if resources are available, then go get tested. Just like other diseases, if it makes you feel better, gives you reassurance, go get tested. And I would tell people it's better to go get tested than to have a worry in the back of your mind. I am very concerned about the privacy issues. When I go to my own office, I got to fill out a checkbox. Who's reading it? In another world, I'm not happy someone taking my temperature and announcing it to the world. So those privacy issues, I think, are really, really worrisome. And I think that moving forward, we need to have a fulsome discussion about what level of privacy do people have. Then the issue about verification and telling the truth. This too is a challenge because in general, in clinical practice, we rely that what the patient tells us is the truth. But in this particular case, when someone makes a misrepresentation or a misunderstanding, someone else can get sick. So I really am very concerned about the public health, the erosion of personal privacy. And that goes to also the app, that the app can be used to tell if you found a close contact, but it can also tell you where you were this afternoon for lunch. And that may not be consistent with autonomy and the civil rights. And so those things really do concern me a great deal. But in closing, I would say the apps are good. They're not perfect. Partly it's because the disease distinction is not perfect, meaning this. I have asthma. If I start coughing today, and I take my inhaler and I start feeling better, am I really a COVID? Should I go get swabbed? Probably not. It doesn't make any sense. Now, if I was at a shopping mall, I'd still wear a mask. So I think that is a challenge. We face this many times now with, when we order testing on people, where we think that the test is completely unlikely to show anything, but the person is more reassured by getting the test. So under asymptomatic testing, they move forward with testing. But that is a big clinical challenge for sure. I hope that answers your question.
It does, Dr. Nathathari, and thank you. Through you, I'll ask a follow-up question with regards to temperature checking and its efficacy. We're getting into a hot season where many individuals are going to be coming off a long bike ride, a hot carpool into work, a number of reasons why someone might be running hot. And we're engaging in temperature checks, contactless. If someone's running a fever, you get them in a cool space, you take a secondary reading. In theory, if they're running a fever, their temperature will not decrease. If they're just running hot, and they're in a cool spot, their temperature should decrease. And so I'm wondering, what the efficacy is in temperature reading, and if there's any challenges that we're looking at getting into a hot season. And that's sort of, just one symptom that could be related to the virus. I feel that our knowledge is increasing as we get further into this first wave. But I wonder what the efficacy is in temperature checks and whether they're worthwhile or what your perspective is on taking someone's temperature contactless. You see these drive-throughs in some other communities where, literally everyone is rolling down the window of their car and they're all sort of getting a temperature check and a quick swab. And I was just wondering what your perspective is on the efficacy of temperature checks.
Yeah, I met with an employer, a large employer, on this issue, and I think that if you're going to do a temperature check, you need to also have some mechanism to recheck the temperature, because people can assume the temperature of their environment, and the thermometer is not particularly good, and it makes mistakes. So I would recheck after 10 minutes. I'm not sure if I had to take from a population health point of view that that's the most valuable screening activity. I think a more fulsome inquiry of symptoms, maybe a more valuable inquiry. But people, and this is a challenge too, people want the objective, quote unquote, objective data. So someone says, I'm feeling fine, somehow that's a patient-reported outcome, so that's somehow discounted. On the other hand, if you flash a thermometer that doesn't really work that well on them, then that's somehow considered a more valuable data element. I think that to prevent the spread of COVID-19, which is the employer's goal, I think the two things are, one is tell people not to come to work if they feel sick, and secondly, do not create a financial disincentive to come to work. So people go to work sick because they feel that they can't live without the lost income. Now I recognize the challenge because you'll have people perhaps who are reporting illness when they're not. But I think those are probably the two most employer-focused items. The third item, I think, is that if someone is sick and feels sick, to get them to the right medical treatment, because they'll view that not purely as a business decision, but also a compassionate item to say, okay, I know you're not feeling well. We have we have a physician that's available, or a nurse practitioner that's available to provide you with immediate clinical care as well.
Thank you. Those are that's very good information to have with regards to preventing COVID-19 from entering the workplace. Those are really the only tools we have at our disposal, and many of our businesses, from stopping the virus from walking through our front door. And I haven't heard of very many other measures other than cleaning surfaces, the wearing of the masks. I've had many questions as to why I'm wearing a mask each and every council meeting, why I'm clearly displaying hand sanitizer and using these countermeasures. I believe them to be best practices, and I'm trying to be a leader in our community and listen to our public health team and act by example, not to the discredit of anyone sitting at this table that isn't wearing a mask or practicing those measures. I'm trying to glean as best I can what those best practices are, and trying to be the ambassador to bring those to our community. And in my life, it's become part of my uniform. It's become no different than putting one sock on after the other in the morning. It's just become the new normal for me. And I'm starting to take that old life we all used to enjoy. It's starting to become blurry. I forget what it looks like. Hopefully one day we can get back to those days. But I've been telling folks that this is reality for a long time to come. I worry about that second wave. I worry about the possibility of people being reinfected. And I'm not a doctor. I've heard a lot of conjecture and speculation about this virus and what's yet to come. And the purpose of me making that comment is I think this Board of Health would benefit if we could have a couple slides in the next presentation about myths. Because I've heard a lot of myths, whether this virus, an individual could be reinfected and get sick again. I don't know whether we're looking at a second wave. It feels like we're still in the first one, from my perspective. But I worry about that next cold and flu season. I think it's going to persist right into the new year, and we're going to really have to think about what that looks like for 2021 for us. So having a few slides, forward-looking, explaining maybe some of the myths, what is best practices, what are the countermeasures that are practical that we can employ. You can put on a mask, but as an individual, we might not be able to save the world and to reverse, this global pandemic. But we can do our small part to try to help keep each other safe. So That's what I'd be looking forward to. And just a couple slides in the future, just some information about what are some practical steps we can do as individuals and as business owners to keep ourselves safe and our employees safe. Thank you.
Thanks, Board Member Rabbits. Member Martin, could I pass the chair to you, and I'd like to ask a few questions myself, if possible.
Certainly, take it away.
I guess my first question would be to Member Van Passen, since he's the most connected. We sent an invite to Toby Barrett, who also happens to be the parliamentary assistant to the Minister of Agriculture, and we've sent a letter to them, and we have not received a response. And I'm just wondering, it seems like this would be a very important meeting for his farmers, and what the reason was that he's not in attendance, since we didn't receive any word.
Well, thank you, Madam Mayor. I don't know. I never got an answer back why they're not in attendance. I did send an invitation. I had a nice long phone call with his executive assistant. And since there was a formal letter sent, there was going to be need for the parliamentary assistant to discuss the matter with the minister. And the timing, all of that, and the fact that there is currently a court or a tribunal hearing that was going on, a potential of an appeal. They needed legal advice on what they could and could not say. So the invitation was made. I think staff have had, and I guess the deputy clerk might be able to verify this, the technology for them to join the meeting electronically was provided to them, I do believe, and we left it up to them to see if they'd be involved. But other than that, I have not heard back. So,
did they respond to you? So I guess, I mean, I've heard from yourself, a farmer, and Member Michelle, you know, that timing is of the essence here. And so the letter was specifically asking for some solutions that we could bring to the table and some ideas to work with. So I see that they're too busy, but again, I thought we were, you know, trying to look for some solutions as quickly as possible. I guess the next question I have, I just want to be clear again, Member Columbus, you mentioned, you actually had some great questions there, I think, clearing up some myths that are out in the community in terms of the testing and so on. One, touching on Member Rabbits' point about the wellness checks and the temperature checks, it's just come to my mind. One of the other things I see repeatedly on social media is how could they not have tested or checked the temperatures of the workers, of the Scotland workers while they were in quarantine. And I'm sure you could clarify for everyone that there were, in fact, temperature checks that were done, but that is not your only symptom, and you may have COVID-19 without exhibiting a fever.
There were wellness checks done on people, and those wellness checks were done by the farmer. They were given some instruction on that, and those documents were reviewed by the public health inspectors. And typically, every self-isolation residence had one visit, Marlene, of the at least one visit of the public health inspector. And then at the end of the self-isolation period, there was an attestation forwarded by the farmer to the public health service, and that was reviewed prior to the release of that individual.
Thanks. And then, Member Martin, if it's okay if I keep going. Then my next question, Shanker, I guess would be, how many examples then to you know, this idea that you're not looking at trying to find ways of increasing the number of 3 to a bunkhouse. How many examples are there currently of bunkhouses where more than 3 workers are being housed?
Yeah, there were 17 agricultural enterprises which subdivided the bunkhouses into self-isolation residences. I have a list here. And they work with the public health inspectors to effectuate that. We also revised our guidance document in addition to that to also highlight the method by which one could achieve that goal.
Okay, so there are ways then to currently house more than 3 workers to a bunkhouse. The idea being there then that you need to have individual or separate washroom facilities, separate kitchen, because that's where it's most commonly transmitted.
Right. And functionally, you do not want the person in one self-isolation residence to cough or share bodily fluids or viral particles with the next self-isolation residence. it can be done, and we have examples of that. You know, when one of the things, just to share, is that the public health inspectors and the individual farmers have pre-existing relationships because they inspected the bunkhouses previously. So there is some dialogue between the public health inspection service and the farmer as they try to formulate a plan for self-isolation.
Okay, and then, so following along that, back to the comment about the arena earlier and why it was not used for the self-isolation for the workers once they had become ill. Perhaps, I guess a couple things there I'm just wondering if you can clear up for the public. For one, we did discuss using the arena as a possible option, and in fact, it was offered to Mr. Biddle. However, it was not the most effective way to clear the workers as quickly as possible to get them back to their jobs at the farm for an operation that had been effectively rendered completely neutral.
Yeah, no, that would be my right. You know, one of our goals, our first and most important goal, is to make sure that people are safe and healthy. And the second goal is to make sure that the disease has not spread to the broader community. But a third goal was to also get people, the people back to their vocational pursuits. And this, going to the hotel rooms was probably the most expeditious way.
Having 80 people quarantining together also for 2 weeks or potentially more if the virus bounced back and forth could have prolonged that significantly and probably was not the best way to treat the staff members themselves, to be housed with 80 people for quarantine.
That's right. I think that this was the outbreak management team, and I'm a part of that team, felt that this was the most effective and humane and compassionate way of getting people better, quicker, and helping the population overall.
Okay. And then I guess there's been a lot of talk, I'm sure you saw the motion from Haldimand County that said that they did not support the appeal, and certainly myself and the councillors have received volumes of letters requesting that we don't support the appeal. Ultimately, it's not the Board of Health, it's not my decision, it's not the Board of Health decision, it's your decision. So regardless of whether or not this board passed a motion to not support the appeal, let me rephrase that. If we did pass a motion at the Board of Health to not support the appeal, could you speak to the board and tell us how that would impact your decision? Would you continue to move forward if, the majority of the board today felt that, we did not wish for you to pursue that?
Well, whenever I write orders, my job is at the intersection of trying to keep people healthy, managing within the statute that I'm ultimately governed by and the Public Health Service is governed by. The decision to write orders, rescind them, modify them, appeal them is one that I have to live with and try to make the best decision I can. Although everyone would like the luxury, I think the Public Health Service has delivered in COVID-19 and the staff have delivered under very difficult circumstances, and we would always welcome the luxury of the support of others. At the end of the day, I have to make that decision alone, and whatever resolution came forward, I may be personally disappointed or it may cause personal angst. I would still have to move forward with that determination that I have to make.
So regardless, if the board today made a motion to not support the appeal, you as the medical officer of health, you have the authority and you alone, and what you're saying is you would continue onwards with the appeal.
That's right, and as the statute is written, I'm not a lawyer, but if I am the party, and so yes, it would move forward, notwithstanding any motion.
I guess, the challenge that I have is, right now we're seeing, there was an article just today again that the federal government is looking at the program and where they have failed the workers. And every level of government looks like they're trying to do more right now and not less. And to pass a motion, I know there's been discussion with that. we could pass that motion, but I'm not sure what that's going to achieve because, as you've just heard from Dr. Nessathari, he plans to appeal regardless of what we as the Board of Health may feel. That said, I also recognized, as I did very early on, that farmers don't want to be organizing quarantine programs. They do have a farm to manage, and that, you know, it is essential for them to be able to get their workers here as quickly as possible. And that was why we came up with this hotel quarantine plan, which we believed would answer all of those concerns. It would be one stamp. There was no submitting individual plans. Norfolk County would take care of organizing all of the logistics. You know, there was going to be, the idea would be that the farmer was going to be billed back after the fact, which would allow some time for lobbying the government for funds to support the program. But again, it was the couple of farming representatives that were on the task force that ultimately decided they preferred pursuing the individual plans. So my thought is that if we could make a motion that doesn't solve anything today, or we could try to, you know, let's make a motion that, you know, we, request the provincial government to manage the entire quarantine program in the same way that they did in British Columbia. And alternatively, failing that, to provide us and other municipalities with migrant workers with the financial resources necessary for us to manage that hotel quarantine program, which again could be put together in a matter of days for the farmers. And I understand, there's discussion in terms of reopening to stage 2 and the suggestion that there's fewer hotel rooms. I think that there are still, a number of hotel blocks that are going to be available out there. Niagara Falls is one area in particular, I'm sure, that's hurting in the wake of all of this. And, there were hotels when we were looking at putting the program together, there were hotels in Niagara, there was hotels in Brantford, there was hotels in Burlington. We'd covered kind of the map to put them together. So, that would be a motion that I would like to propose to council.
Looking to council, is there anyone who wishes to second that motion? Councillor Rabbitson wants to speak to it?
I would like to second the motion and speak to it. Thank you through you. I think that it's important that, once we've acknowledged that we've had a shortcoming or we've made a mistake, we try to right that wrong, or we try to make things better. There's two ways you can approach a problem when you realize you've made a mistake. You could lie about it, you could blame someone else, you could just cry, or you could try to fix that mistake. And Dr. Nessathori, if you believe that this program would improve the living conditions of these migratory workers, and you wish you could set back the clock a little bit, there's nothing stopping us from making a point today, drawing a line in the sand, moving forward and doing something that can help our community. So that's the reason why I'm seconding this motion, because I think it is going to have a positive impact if we can achieve anything at our meeting this evening. I'd be really interested in hearing, from my colleagues, before we go to the vote, what their thoughts are on trying to provide some accommodation for these workers. This seems to be some form of a compromise to me. We could do nothing, or we could try to provide some adequate housing for these workers, and we could try to move forward and try to get them onto the farm, do that essential work. Thank you.
Councillor Taylor, did you want to speak, or you were looking? Okay. Any Councillor Columbus? Sorry, Board Member Columbus.
Yeah, Deputy Chair, can we hear from the clerk to read that motion aloud again, please?
Would be that council requests the provincial government to manage the 14-day quarantine program upon arrival into Canada in a similar manner to the program that was initiated by the British Columbia provincial government. Alternatively, to provide our municipality with the financial resources necessary to manage the hotel quarantine program locally.
Just a question. With respect to the large farm outbreak, did we not just learn recently that the migrant farm workers that were actually housed in the hotels, is that not where the outbreak came from, Doctor?
Well, I think we're at the beginning of our epidemiological assessment. I think it is likely that some migrant farm workers did not report their symptoms. And I think the reasons for that are more complicated than they just chose not to report. They were under probably immense pressure to continue working. But I do think this motion would serve a very important signal of how important, because one, it would show leadership to the extent that this Board of Health shows an understanding of the challenges with the self-isolation period, and failing immediate action by the province, that the county would move forward on a cost recovery basis for this self-isolation program. And the Public Health Service and I personally, we would support that self-isolation program if sponsored by the county.
Well, I certainly support going to the province, either for dollars or for getting involved more closely with operating the migrant farm worker program. But I'm not so sure that isolating workers in the motel room for 14 days is the right answer, being the experience we've had with the largest farm outbreak locally.
Any further, Board Member Chop?
I was just wondering if perhaps Dr. Nessathari could comment on that again. I think there's a misunderstanding there, Member Columbus, that it's not that they caught, or the idea that they caught the COVID-19 in the hotel room. I think it was actually an example of how effective that was. Scotland Farms moved over 240 guys in a matter of weeks into the country when everybody said that it couldn't be done.
Madam Chair, my apologies. Those individuals, first of all, we're at the beginning of our epidemiological assessment. But those individuals likely were infected or were infected in their home nation, and during the self-isolation period did not disclose their symptoms. And if they had disclosed their symptoms, it's likely we would have extended the self-isolation period, and that would have probably had some impact on the outbreak. So I think that's probably what the evidence would suggest. When we finish our epidemiological assessment, I will come back to the Board of Health and report on it in a more fulsome way.
Board Member Chop.
Thanks. I guess the one other thing too, I think it goes back to Member Martin's comments earlier and trying to compare the self-isolation period to, what happened with the outbreak after the fact. But the idea being that post-travel periods from endemic countries is still your higher risk period. Although that wasn't what necessarily, we don't know yet, what caused, the largest outbreak that we've seen in the country. But the fact that you could have had so many more outbreaks, how many did you say are as of today in Windsor, Essex?
When I spoke to the medical officer of health in Windsor, Essex, it's 26 farms are affected.
So 26 outbreaks in Windsor, Essex, and we have had 2, technically.
We've had
one outbreak.
One outbreak, and the others have been in the self-isolation residence, and we were able to contain them. We had 11. It is likely that we'll never know until the year's done, but it's likely that we have contained a few outbreaks just by limiting the number of people in self-isolation residences.
So the idea being that if you had, 30 individuals that are quarantined together, the fact is, if that is your higher risk period, now you could end up the county managing multiple outbreaks, or the public health unit rather, of much bigger magnitudes, 20 workers, 30 workers, as opposed to the other situations where they were immediately split up and, only 2 or 3 workers were impacted and the farm operation was allowed to continue.
That's correct. That's correct. It limited that. It limited the magnitude of the effect on other workers.
And on the farmer.
and on the farmer, and on the enterprise for sure.
And so would you also, I mean, there must be, would you agree, some benefit to, you know, the health unit in the county running such a hotel quarantine program as opposed to expecting farmers to try to manage that on their own?
Yeah, if, it definitely would be it would be better for the person served, the migrant farm worker. It would be better for the public health unit. I think it'd be better for the community if there was a welcome center. We could help formulate the welcome center. So yes, I think that would be an improvement if the county could do that. And I think the team at the public health unit would think of that as an improvement because they would be greeted, received, put into self-isolation, and discharged in some organized manner.
My question to the deputy clerk is, I'm wondering the intent of going into closed session was to have a discussion, because I personally don't know that I want to vote on a motion prior to getting all of our information out on the table. I'm looking at you, Board Member Columbus, because I know that you had mentioned it wasn't on the
Yes, I
agenda.
believe we all received a lengthy letter from the lawyer, the opposite side learners, and I had some questions with respect to that because I think they're important to get answers to.
Yep. Deputy Clerk.
Through you to the board, unfortunately, this letter was added to the agenda last minute, and it was one that we should have reviewed in advance and allowed the county solicitor to review in advance. Unfortunately, the clerk believes the letter itself is inconsistent with the Board of Health procedural bylaws, specifically section 8.4. And what we as staff, and I believe Jason Burgess went to go and get Paula, we've been talking about this, but what we are asking is the board consider to pass a motion reversing the decision to add this item to the agenda and receiving the correspondence from Ms. Plum for information. And again, so it's just basically that in light of this information, the county solicitor would like to further review the letter itself. We believe that it's inconsistent with the procedural bylaw, and we just have not had an opportunity to do a fulsome review. And so that's kind of, I can answer some questions, but again, I think Paula and Jason are available as well, but that's what staff are recommending.
Board Member Columbus.
Thank you, Deputy Clerk. I think that's acceptable. We don't have our lawyer with us here to answer some of these questions. But when's our next Board of Health meeting? Is it next Tuesday?
Sorry, Board Member Columbus, she is here. I think she'll be joining us.
Oh, she is here. Okay. Well, I don't know what everybody else thinks, but as long as we have a meeting, say, next Tuesday, with respect to this, I'd support that. Thanks.
Thank you. Through the chair to the members. Yeah, basically, so what we're looking for is, again, and it is our apology, we tried to get this on. It was correspondence received last minute. We should have done a review on it, but we wanted to add it because we thought we would add it because it was related to the agenda. After reviewing it, however, we realized that, again, it has that inconsistent wording and language to what our procedural bylaw allows. By having the board pass such a motion, it gives staff the opportunity to deal with it and then have speak to Ms. Plum and hopefully have the correspondence changed up a little bit so that it can be consistent with our procedural bylaw and the language. So the next Board of Health is scheduled for early July. I don't have the date specifically, but it'd be the first week of July, the first Tuesday of July, and perhaps that is something that we can add. But again, we are requesting that the Board of Health consider a motion to, and I can read it if you'd like, the motion.
Madam Chair, I really think we can't wait till July. I think we need answers to some of these things that have been put in front of us as a Board of Health as soon as possible, and I would ask that we do that next Tuesday. We're all here anyway for a meeting, aren't we? No? Okay, well, as soon as possible.
Through the chair, one consideration is staff was going to ask for a special council meeting to deliberate matters of Norfolk County activity, and we were intending not to do it next week, but the following week, the following Tuesday, so quicker than the July date. If that is an acceptable date, we can combine the two meetings. Otherwise, I don't want to commit. It will be a lengthy report on the opening of hockey arenas and that kind of stuff. So we want to give you good information for that decision. So if it is acceptable, we're planning on, I believe it's June 30th, if I remember the date. If that's acceptable, then you'd have both meetings on the same day.
So considering the circumstances, that's about 2 weeks away? Okay. Yeah. Okay, good. I'll support that. And that, we just received this today. I can fully understand that our lawyer hasn't had a chance to really in-depth review of it. Thanks.
Councillor Board Member Taylor.
Thank you. Through you, would this motion affect any of the current isolation plans? What could we expect coming forward with how things might need to be changed for the current isolation plans?
No, I don't think it would change the current self-isolation plans. I think people moving forward, if they chose to use this option, I think that would be a good option. But it wouldn't change any of the previous self-isolation plans.
I'm not seeing any. Councillor or Board Member, sorry, for Van Passen.
Thanks, Madam Chair. I just don't even know what to say about this. This is something we just need to support. We need to get the help from provincial and federal levels. But it doesn't. Back in March, a Section 22 order was issued that this board had no input into, no consultation for, didn't even find out about it till about a week later. Farming community was not happy with that either. In the meantime, we have spent a lot of our staff resources, our financial resources on legal fees and tribunal hearings, and that's not stopping. They want to continue more and spend more money on lawyers that could be spent actually on the health and safety of the workers, of the farmers, of the community, but it's going to go back to some more lawyers in the big city. And we have no control over any of those things. It's not this board's, it's not within our ability to decide whether we appeal to divisional court or not. It was not in our authority to actually issue the orders. Those are all things that we have no control over. Now, we do have control over a budget. That's about the only thing we would have control over. And we could, threaten to just not pay for any more legal action, but that would probably cost us more money in the long run because that would abandon one of our employees, and that's untenable in itself. So we're stuck again between the rock, the hard place, the cliff, and the river. I don't know how many more places they can jam us into. So groveling up the ladder to the province and the feds is about the only option we have. So we might as well do that to the best of our ability. So I will support the mayor's motion.
Board Member Rabbits.
Thank you, and through you, I did have one question for Board Member Columbus, because he did express in his comment support in part of the motion, and so I was wondering if it was his desire to divide the question, or if he wanted to have this tabled in whole.
Yes, I thought about the division of the question as well, Councillor Rabbits. I fully support that we take this to the province to see if we can work something out with respect to a program to accommodate it in the near future and also in the late future. And I think that's important. But the 14-day quarantine period in a hotel where we know that hasn't been the best to warehouse these workers, migrant workers in a hotel, I mean, it's really no life. It's being almost like a prison. I don't think that's the right place. And we heard from 2 leading growers in our community, and they agree. That's why they didn't agree with that original proposal. So I would suggest, your suggestion is right on, divide the question.
Seeing no further hands, I'm looking over at Board Member Huffman.
Thank you. Do you mean divide the motion?
Divide the motion.
Okay.
I said question, yeah. Sorry.
Okay.
So while I leave that with the Deputy Clerk for a minute, I'm not seeing any further hands. I'd like to make a, go ahead.
I don't really understand that. It wouldn't be that they have to do that. They would still be able to do their own plan if they so chose. They would still be able to work on more than 3 to a bunkhouse if they were willing to do the partitions and the individual, like the separate kitchens and the separate bathrooms, which are typically the vectors. So that option would still be there. This is only to help the farmers because speed is of the essence and they need to bring in large numbers. And you're saying that the bunkhouses under Shanker's plan aren't working and he's not willing to drop the appeal. So this would just be an option that would be available to them with the county putting resources towards it so that they could bring in multiple workers at the same time if they so chose.
I guess, Madam Chair, I'd have to hear the motion again. I didn't realize that that the motion included on-farm housing. I thought all I heard there was that it was basically motel, hotel housing in that particular motion. So
I didn't specify that they aren't, but that was always the idea from the beginning. They could pick and choose how they, wanted to.
From the way the motion, I understood it, it didn't have all that in it, that with respect to on-farm housing also.
If it would be okay, then the second part would be then alternatively to provide municipalities with the financial resources necessary to manage a hotel quarantine program locally if the farmer elected to participate.
So that, the understanding is that includes on-farm housing, 14-day quarantine as well.
They could continue to do their own program through the public health department. This would just be for those that already have workers in their bunkhouses on the farms and they need somewhere else to quarantine them, as an example.
Okay, I think Ian's got some.
Board Member Rabbits.
Thank you. Through you, to my understanding, the program is non-compulsory, right? This is a program that we're offering, and as a Board of Health, we're authorizing our staff to endeavor to deliver this service. So it is non-compulsory. From my perspective, perhaps that should be worded in the motion. I'd be amenable to it. Or perhaps I've misunderstood something because I see some hands from behind you that want to speak to it. I didn't mean to confuse the matter. I thought the mayor's motion had 2 clauses. And so I thought you had agreed with 1 clause, but not the second.
So through the chair, if I may, just to clarify, I believe our board chair's intent, and correct me if I'm in error, is that the order as it stands would stay in whole. The farmer would submit a self-isolation plan, and they could do exactly what they're doing, or they could opt into this hotel option that we would be prepared to run. They would still have the option to do either or, no different than what some of our farmers have already achieved and have actually had approved by the health unit. So I hope that clarifies. From operationally, nothing would really change. This gives them another option that we would help run for them and work with the farmers to support them.
I guess I'm just wondering why we need this as a motion when this was a plan that we were going to adopt initially. And my other concern is that while I support fully sending a motion and approving a motion to find additional help, we don't know how long that's going to take. 1, what if the response is there's no funding available for that? 2, then we're in no different position than we are sitting here right now with the ag community asking us for help with a ticking clock on their harvesting schedule. So I'm just not sure what we're really chipping away at here.
Well, I guess it's an attempt at trying to do something as opposed to doing nothing, because the alternative is, you've just heard from Dr. Nessathari, he will not drop the appeal even if the board votes unanimously to have him drop the appeal. It's his decision and his alone, and not ours. And so it's just trying to come up with a way that addresses this challenge that, we can't wait until, weeks down the road, that the farmers do need to get workers here still now. And so it's just an attempt at a solution. And the difference between now and previous is that would be specifically requesting the province and the federal government to fund the program, because the big concern for the farmers previously was that, was the expense of being able to do it. So I think all levels of government right now are recognizing that they have failed the migrant worker program, given the challenges that they've seen. So I guess I'm hopeful that provincially and federally, there's more of an appetite now to do this than there was, back in March.
I don't disagree with supporting it, and I think that we do need help, but I don't think it solves the reason why we're gathered around this table here today. We've been asked to iron out something and provide assistance to the ag community, and to me, while it's necessary to ask for help, I don't feel like I'm helping anyone with that. I would support this motion, but I would almost like to see something more with it. I guess my comments are, in general, we lost, and I know, I understand that Dr. Nessathari is the client, and he's going to pursue this, and that is his right to do that, but I'm slightly comfortable with defeat right now, knowing, and what I'm not comfortable with is knowing that we have an agriculture industry and community at large with total unrest and angst. And the one thing I know for sure is that they're going to be here long after we're not in these seats anymore. And so what are we doing to help them? And again, I support this. I know that we need to get additional requests for help, but how long is it going to take to hear in response from them? What if there is no funding available? And initially the farmers weren't interested in this program. So I just don't see what we're doing today that supports the agriculture industry. Board Member Taylor.
Thank you. And just in response to that, I think this is, I don't think there was a condition in the second half of the motion that said we wouldn't run the second half of this motion if there is no response from the province and the feds. I think this is a great opportunity to extend that hand to help. And we understand that we might get that unfavorable answer back from the province and the feds, but we need this program to help the farmers at this point. So I think this is a very important endeavor, and I'm very happy to support this.
And I don't disagree with that. I just know that some farmers were consulted and opted out of this program. Board Member Huffman.
Thank you, Board Member Martin. Some of this is going to be a little bit too little, too late, and I think what I'm seeing around the table with some of the differing opinions and some of the motions that are now coming forward are hearing things that the Board of Health should have been consulted on from the very beginning. The fact that I was never made aware of what this hotel plan was, other than what I read in the newspaper and those types of things. Still don't have a clear understanding of the whole process, but I think there were a lot of things that the Board of Health that we're accountable for, but we were not made aware, and we were not included in keeping up to date. I've learned more in the last 2 days, not learned more, but basically all of the information that's come forward is information that we should have had going back to the second week of March. And I think that that's done a great disservice to what the Board of Health could have offered and offered, in terms of what our understanding was of the circumstances. But, and we do know that we're put in a bit of an awkward position because we are council and we are also the Board of Health, and that there are two distinct roles there. But moving forward, I do support that we need to go to the province. I don't feel that there's an appetite right now, possibly, for the province to work so willingly with Haldeman Norfolk at this point in time. but we can give this just a try. But again, as Board Member Martin said, it doesn't really solve anything at this point in time, at this juncture. We're at a critical juncture, and we do, and I will refer to, as Councillor Van Passen, Board Member Van Passen said, we have a very vulnerable population of people when we're looking at the health and well-being of our agricultural community at this point in time. So I still feel like from Tuesday to today that we're still just going around in circles, and there are some harsh decisions that have to be made. And I do want to put forward that I do understand that Dr. Nessathari will continue with the appeal. My question to the Board of Health, is it our mandate that we have to fund this appeal?
Through the chair to the board members, I think you received advice last session in closed session of the implications if you chose not to fund the appeal. There would be costs and consequences of that. I would be more than happy to recirculate a written memo on that, but I think that was updated at the last meeting. And since it was an in-camera discussion, I would keep it in camera, but I can add a written memorandum to board members for that.
I guess my understanding was, and part of the reason why on Tuesday I had suggested coming back on Tuesday was to get some answers to some of those things, and I was hopeful that maybe we would be getting that today, again referencing going into closed session prior to voting on a motion today, because I think that there was still some clarity that on my, personally, that I was searching for with regards to that. But Councillor Board Member Van Passen, did you have a comment?
Thank you, Board Member Martin. Again, this is where this frustration keeps coming up. Like a month ago, we had a meeting of the Board of Health, and we asked that the Medical Officer of Health review the changes in the situation since the order was first issued, and see if there's any room for adjustments or amendments. And well, nothing happened. A couple days ago, we put forth another motion that we ask again that the Medical Officer of Health look at that Section 22 order and the conditions that go with it, and work with some of the farm community and staff to see if there's other ways to get the same result. Like, is there a possibility that 10 little things add up to one draconian measure? And, by doing those 10 little things, maybe you could adjust the numbers from a hard and fast 3 to, based on the size of the building or something to that effect. And, those are the things that we keep asking for. But I think we're going to get, the way the situation right now is, I'm sure legal advice, just to keep a certain lawyer's record intact, and she doesn't want to lose a court case, that nothing will be changed, nothing will be attempted to be changed until they're done with the appeal, because that would just look bad in court. That's sort of like conceding that, yeah, I was wrong because I was willing to change it, but at the same time, I want to argue it in court that you guys made a mistake and I shouldn't have to change it. And, is this going to cost us more money and time and not achieve a good result because of the pride of the legal team that we have in place? Or is the intent for the best interest of the workers? And, that's the answer I'd like to hear. But I do have a question to the clerk. Does the motion refer to the program in BC? Because the program in C is government program, it's all or nothing. There is no other game in town. So you might want to amend that, Madam Mayor, to say similar to a government program or make one available. But if you want to make it the same as BC, that eliminates the option of the either or.
The wording was a program similar to that run by the BC provincial government. If I could, Member Martin, I hear what you're saying. I'm just wondering what is your solution then? What's an idea? Because to me, we just keep going around. So this is an attempt at a solution. So I'm curious to hear some other ideas then.
I didn't put forth a solution because I don't have a solution, but I'm certainly well within my rights to comment on a motion that I don't think serves what the ag industry has asked of us to come together here for today. And further to that, I specified that I support a request for help. But my point is that I don't think that we're pushing the envelope for them as is. I think they'd rather have a Board of Health that came out and said, you know, we support them and that we don't support the appeal. At the very least, should that change nothing, at least they're feeling heard and supported. But again, it makes no changes. So that's why I put it back specifically to my colleagues for further discussion. Board Member Van Passen, then Columbus.
Thank you, Board Member Martin. I'll support this motion because I think it's what the majority of this board has been doing for the last few months, but it does put it on paper and it's official motion of the board. But, you know, we've been doing whining all the way up and down the ladder since March and April. You know, we've got some results on a few items, like the funding for the farmers and that $1,500 to help pay for the wages they have to pay the workers in isolation. You know, there's been phone calls, and anybody who knew anybody in Ottawa was on the phone, and I think, well, Councillor Columbus could probably attest to this, that we're lucky we've got the people in Norfolk County, because it wasn't just members of this board, it was individuals and somebody who knew somebody, and somebody who had a friend who used to work for the minister's neighbor's kid's cousin, and you know, we did achieve something. This is sort of formally puts it on paper what it does. I hate the motions, you know, to make you feel good. We could put forth a motion that we don't want to appeal the decision, but there's no real purpose to it because, again, that's not something we control. And you know, I don't need to feel good. I need to get results. And you know, are there other ways? Are there other avenues we haven't tried? This is one. You know, we're still waiting for more ideas. There's other board members that maybe have thought about this and had sleepless nights worrying about it. But you know, what do we need to do to get the result that we need to achieve? To put forth a motion that we're opposed to this or we're supportive of that, it serves no real purpose. But it'll make you feel good, right?
And it demonstrates to the agriculture industry that we hear them.
Well, I think that they sort of know that we're on their side, but
I don't.
Okay.
Board Member Columbus.
Yes. Mentioning the 14-day permit to take isolation in a motel, it's always been there from day one. You know, it's always been in the equation. We saw the Biddle operation do that, the Scott Lynn operation utilized. Perhaps others did too. So I don't know why we have to mention that separately. If somebody wanted to put it in their isolation plan last week or a month ago, it would have fell in the right realm to make that happen.
Board Chair Chop.
The difference this time is the federal government has just acknowledged that they have failed in managing this program. That's the difference. Now maybe there is an appetite. The concern with the farmers was driven by cost, was the issue with the hotels. And so now maybe there is an appetite that we could either get them to manage it, something similar to the program in BC, or similar to when they repatriated the Canadians off the cruise ships and they went to Trenton. The farmer would not, you know, have any of that stress and hassle to deal with. And the difference is now that it's becoming a very, you know, public issue, migrant worker advocacy groups and so on, there are bigger concerns there. Maybe now there is an appetite for more funding and for more involvement from those levels of government than there was previously because they've acknowledged that they have failed the program.
But the BC program, it's my understanding, there was no isolation permitted on farms. So that's the difference here. Is that not correct, Deputy Clerk?
I'll address the question. That is correct. There was two provinces actually that ran a similar program. So they isolated the workers immediately from the plane into a hotel. So there was both British Columbia and Prince Edward Island that ran similar programs on that fact.
So it's my opinion, we certainly don't want to follow that, no isolation on farms.
Well, through the chair to the member, and that's, you know, you can deal with the wording as it is. I think I think the premise of the concept of a hotel was individual isolation or self-isolation. So it's one person being isolated by themselves. I don't know if the location of whether it's a hotel or not is important. In fact, if you look at what happens now if you come into Canada and the border services doesn't like what your plan is, they actually will direct you to and they will take control of your isolation plan. And sometimes they put you in a university setting or a hospital setting, and that's how they control it. So I think the key is not hotel, it's self-isolation, one per unit, I think is the, and whether that's on that. I think the challenge, if I can just elaborate, I think the challenge is more acute now because farmers have workers working in their bunkhouses, and the next wave of workers, there's a piling up effect. So before, where they had empty bunkhouses, they could bring in 3 and deal with it. I think there's a more acute issue with the additional second set of workers that are coming in, that the need for organizing self-isolation units is going to become even more pressing for the farmers, and I think they need some solutions. I would add that if there is such a program, there is more money out there now than there was before. So the province of Ontario just issued a fund specifically for farmers for $15 million. It has a wide range of uses. One of the easy things that could happen is you can ask the provincial government to change some of the requirements or some of the goals of that $15 million fund, or add a bit more money to it to effectuate some self-isolation plans. That wouldn't take long, or just be able to use that program. And the other thing I would say is that, just to be clear with everyone, I have a utilization issue here with staff. So the current order that is under appeal never changed the Section 22 order, changed a thing behind the Section 22 order. So individual plans are still needing to be filed. And now, if you just accepted the order at face value, that could cause delays to the farmers, because now we'd have to individually assess each farm. So if in theory, Dr. Nessathari would not appeal that, this board has to assess the impact to the farm on that cases too, because that case has not been made yet. I have concerns that actually is worse for the farmers. I'm not saying it's proven or not, but you have to assess that as a board. That if you did appeal, and if Dr. Nessathari agreed to that or dropped the appeal, you have to assess the impact of that action. And I don't think that is clear. The early indications, and I won't speak for the public health unit, is that they won't be able to accomplish the turnaround on individual plans as quickly. And there's nothing that's proven that says that farmers would be able to increase dramatically what they're doing already for a number of farms to meet the health standards. So I think that evaluation has to be undertaken. Secondly, if there is a organized plan, like the one that was presented, and I will circulate to the board members the material that we had created originally for the plan, I think it takes, there's a significant amount of administrative function that comes off of the farmers for managing it, because the administration is now done by, frankly, the county. And if you take that administrative function alone off of the farmers, that's a net advantage to the farmers. And if you did the same payment schedule for the farmers, where we would collect in a couple of months after all the costs come through, we carry them for a bit, there's a financial advantage to the farmers. So, even if there was no money, frankly, from the federal or provincial government, there are some slight advantages to the farmers in administration and time value of money. If there is additional federal or provincial funding, then that would also be an advantage to the farmers. So I think, the board needs to evaluate all those different scenarios, and I would be more than happy to put together a 2 or 3 pager for the board to contemplate, if so required. But I think on different options going forward. But I just wanted to, answer your question, and I think there was some missing information in the discussion.
Board Member Huffman.
Thank you. Thank you for that information, Mr. Burgess. It's quite helpful because, like I said, I think a lot of this information is coming at us a little bit too late in terms of being able to make these decisions. And based on that, until more information comes forward, I would like to move for a deferral.
Deferral takes precedence, so I guess we'll vote. Recorded vote? Sure, recorded vote.
Okay, do you have a date that you'd like it deferred to, Councillor? Sorry?
Sorry, seconder for deferral. That was a close one because I'm seeing none. Okay, back to the original motion.
Okay, through the chair to the mover is Board Chair Chop. I'd just like to clarify because there was some back and forth. So if I could read the motion again, just to make sure that we are correct, and then I could go into the recorded vote. So, and again, please correct me if I'm incorrect. Moved by Board Chair Chop, seconded by Board Member Rabbits, that the Board of Health requests the provincial government to manage the 14-day quarantine program upon arrival to Canada, similarly as managed by the British Columbia provincial government, and that alternatively the provincial government provide financing if requested by an individual farming operation necessary to manage a self-isolation program for migrant farm workers.
No, it was alternatively for the provincial and federal government to provide the municipality with the financial resources necessary to manage a hotel quarantine program locally. Or self-isolation, my apologies, yeah. Correct that word for sure.
Okay, I've corrected that. Then if the board is ready, I can do the recorded vote. Board Member Rabbits.
Yes.
Board Member Columbus. Board Member Martin.
Yes.
Board Member Van Passen.
Yes.
Board Member Huffman.
No.
Board Member Michelli.
Yes.
Board Member Taylor.
Yes.
And Board Chair Chop.
Yes.
The motion passes.
Thank you, Chair Chop. With the utmost respect for Dr. Nessathari and all of our staff in the health unit, I know you have a very difficult job and you are experts in your field. However, you know, I feel like a win for us is a bit of a loss for an entire industry. And that industry is still asking to abide by regulations, just not the ones that Norfolk County feel to be best. At this time, I would like to just go on the record stating that I don't support the appeal, and I'm happy to move that as a motion.
Board Member Michelli, go ahead.
I would second that, Madam Chair.
Further discussion? Go ahead.
Madam Mayor, I just find it that we're in a rather strange world anymore when there's a court case working its way through our system in this country that it's against the constitutional rights of criminals to be penalized by putting them in solitary confinement for 3 days as punishment, because that's cruel and inhumane punishment. But good, honest, hardworking people can get locked in a hotel room for 14 days straight, and that's a good thing. And I just don't seem to understand that anymore. Maybe I just don't understand how the world works nowadays.
Mr. Burgess.
Thank you. Through the chair to the board members, the county solicitor would like to advise you prior to voting on this motion to consider receiving legal advice in closed session, but it's...
Okay, are we prepared to move to closed session? Is there a mover?
I will move.
Seconder? All those in favor? Oh, right. Okay, the motion again moved by Board Member Rabbit, seconded by Board Member Taylor, that the Board of Health move into closed session at 6:24 p.m. to discuss matters pursuant to sections 239(2), personal matters of an identifiable individual, including municipal employees or local board members, litigation or potential litigation, including matters before administrative tribunals affecting the municipality or local board, and the receiving advice that is subject to solicitor-client privilege, including communications necessary for that purpose. All those in favor? That's carried. Again, I have a mover and a seconder that the Board of Health reconvene in open session at 7:08 PM, and the Board of Health received legal advice in closed session respecting the appeal. Moved by Councillor Rabbits and seconded by Councillor Taylor. All those in favor? And that's carried. There was a motion on the floor, moved by Councillor Martin, seconded by Councillor Michelli. Councillor Michelli.
Thank you, Madam Chair. Upon further consideration, I have decided that I would like to remove my second of that motion.
Okay, and Councillor Martin? Or Board Member Martin, my apologies.
Thank you, Chair Chop. I would just like to further articulate that I support Dr. Nessathari. I just do not wish to see resources spent on this appeal, and I would like to leave the motion on the floor.
Okay, is there a seconder for the motion? Member Columbus? Any further discussion on that? Sure.
I appreciate the motion that Board Member Martin has brought forward, and just wondering if she would be interested in a friendly amendment that a motion that due to, from receiving legal advice from our legal counsel, that it puts us in a very vulnerable position to basically put a motion forward that we do not support the appeal because it puts our medical officer of health in a very fragmented situation. And it's not anything that we want to him to perceive lack of confidence or anything like that moving forward, and that we do want to make sure that we extend all options of things that we can do to assist our agricultural community at this point in time due to legal advice. It does not make sense, and it puts our risk at a very high level. So I was just wondering, in terms of a friendly amendment, if we could maybe put something like that into your motion. Thank you.
I'm not, thank you, Board Member Huffman. I'm not sure what that spells out, unless the Deputy Clerk has something that she would like to articulate for consideration to add, but I hear you, I understand you fully, and I do appreciate that. I just don't know how that manifests into some type of friendly amendment to the motion.
Through the chair to the board, just kind of thinking out loud, and what I'm kind of hearing from Board Member Huffman is something along the lines of that, notwithstanding the board's utmost respect to the medical officer of health and his position during the COVID-19 pandemic, the Board of Health indicate it does not support the medical officer of health's decision to appeal the Health Services Review and Appeal Board to strike down the 3-worker per bunkhouse limit during the COVID pandemic.
I'm fine with that. However, I think it's very similar. I don't think it helps Board Member Huffman with her point, but I'm fine with that language.
Well, I was suggesting in my thoughts that we keep Councillor Martin, or Board Member Martin's motion on the floor, and then have what Councillor Huffman has suggested, add that as a direction, to give direction rather than a part of the motion. But I will go with Councillor Martin's support there. Thanks.
Thank you, Board Chair Chop. For my 2 cents, the lawsuit has somewhat complicated matters for this council. We've just received some legal advice, and based on that solicitor-client privilege, that advice that we had received, I can't be supporting this motion. In principle, I have voiced a vocal opposition to the 3-person per bunkhouse rule. I do defer to the doctor's medical expertise and the necessity for that limitation, and I'll continue to verbalize that I'd like to see that limit increased, hopefully, once we get further down the road in this pandemic, that can become a reality. But from where I sit and from my perspective, a constructive conversation around that 3-person per bunkhouse limit really can't happen fruitfully until this lawsuit is settled and it's put behind us. So based on the advice that I had received and we all had received in closed session, I can't be supporting the motion. I will not be.
Okay, to proceed then with the recorded vote, Board Member Columbus,
Yes.
Board Member Van Passen,
Yes.
Board Member Huffman,
No.
Board Member Michelli,
No.
Board Member Taylor,
No.
Board Chair Chop, Board Member Rabbits,
No.
and Board Member Martin.
Yes.
The motion is defeated.
Board Member Huffman.
Thank you, Chair Chop. I would like to put a motion forward that the Board of Health continues to work very effectively and cooperatively with our medical officer of health, but most importantly, that we would like it to be known that we will endeavor to do our best to work side by side with all of the members of our agricultural community. And based on legal advice, it was not, it's too, this is going to be too wordy, but you can fix this up for me, Steph, I'm sure. Basically, we need to make it clear that the reason that we couldn't support the motion is that due to legal advice, it was not good advice to support that motion, where it could have led us down a road that we didn't want to travel. So I think it'd be very prudent that the members of this Board of Health, it be known that we fully support our agricultural community, and we will move forward in any which way we can to assist the board and look forward to a solution to this current appeal that is taking place.
Do you want to read what? I'm not sure what that is.
Through the chair to Board Member Huffman, I started to work on something, and it is along the lines of, whereas the Board of Health continue to work effectively and respectfully with the Medical Officer of Health, therefore be it resolved that the Board of Health will continue to work side by side with the agricultural community while adhering to the Health Protection and Promotion Act, or is that kind of where, along the lines of more, not so much as direction that you were looking at, you were just sort of making a statement then, a motion of statement, or? Yes,
a motion of statement, just to clarify that there was certainly a lot of discussion in regards to the agricultural community, and we wanted to make it very, very clear that we will continue to work with them, and we certainly did hear them.
Okay, seconder for Councilor Huffman's, Board Member Huffman's motion. Board Member Taylor. Any further discussion? Okay.
Okay, Board Member Rabbits.
Yes?
Board Member Columbus. Board Member Martin.
Yes.
Board Member Van Passen.
Yes.
Board Member Michelli.
Yes.
Board Member Taylor.
Yes.
Board Member Huffman.
Yes.
Board Chair Chop.
Yes.
The motion passes.
Okay. One last thing, just for the Member Michelli.
Thank you, Madam Chair. I'm just asking, we passed and discussed these motions at great length, and I thought we still had opportunities to ask the doctor some questions.
Okay.
Or has that time passed?
I think we should start looking at wrapping it up, but if you have more
Well,
questions.
this is hopefully a fairly quick question, and maybe I'm not sure what the answer will be, but I began a little while ago, Dr. Nesathare, asking about, now that we're in stage 2, about washrooms. Also, now that we're in stage 2, with regard to the beaches being open, and we have just learned that Norfolk County has 3 beaches. 1 is now closed. So now we have 2 beaches, and I'm anticipating that it will be a very hot weekend. There will be many, many visitors coming to those 2 beaches. And I am asking if there is a strategy that our health unit staff have to ensure that the proper social distancing will take place, especially in some of those spots. And I'm in my personal sort of situation in Long Point, there are some very, very narrow accesses to very, very narrow strips of beach. And I'm a little bit concerned, and I think people who live there are concerned that that social distancing will be very difficult. So I'm wondering if you could just comment on that.
The only thing I just want to fix with your statement there, that is not Norfolk County's beach that was closed. So you said Norfolk County's beach, one of them is closed. We don't really have control over any of the beach.
I'm sorry, Madam Mayor, do we not own a very small section of beach in Port Dover?
66 feet at the end of, so.
And
okay.
am I correct that that's closed?
What's that? The 66,
That is closed?
the 66 feet, because
Okay.
the private owners on
Okay.
either side of the 66 feet have
I
wished to have
understand
the
that, but
property closed.
we did have Norfolk County signs up there that our beach was closed.
Shanker.
Yeah, I'm very worried about, I'm worried about, I'm worried about the beaches, I'm worried about other areas where people will be tightly confined. So the one power that we have is the power to educate people, and I don't know if we can get on radio. It's Friday afternoon now, but I am very concerned about this. I think the challenge is that how do we enforce social distancing, and maybe Paula, I think legal counsel. I may ask legal counsel to comment on this.
Pardon me. I mean, I'm no longer directly supervising bylaw, but I am still on all the emails and reading everything. And so I do know that our bylaw team will still be out there at the beaches, checking for social distancing, making sure people are moving along if necessary. So we still will have that. And in terms of Port Dover, that's a fairly unique situation because we own so little of it. Obviously, if the remainder is closed by the owners, then there's very little point in having our 66 feet open. So the plan is to continue to staff on the weekends appropriately to be out there and remind people about social distancing.
Go ahead.
So there isn't a specific strategy other than having our bylaw enforcement people. Are they going to be on the beach?
I'm just going to let Mr. Burgess answer.
Sure, you have to remember that the other beaches are actually owned by the province, so they have their own forces that will be enforcing their rules, and there's on their websites they're saying what they're doing, and we will enforce social distancing on that. So we maximize our resources on the weekends in bylaw, and we hit the hotspots, and the beach will be some of the hotspots we hit this weekend for enforcing the social distancing guidelines.
Thank you. And Madam Chair, if I can just make one more comment. I just wanted to mention this. I think we were remiss about this perhaps on Tuesday, but I just want to mention that our county solicitor, Ms. Budis, is on holidays this week, and she has been pretty much working the whole time. So I just want to let her know that we appreciate that. Thank you.
Okay, Member Columbus.
Yes, with respect to the beaches, I've said this before. It would be a good idea to invest in some bullhorns. I think it'd be a low-cost way to move people, crowds. And I think it should be looked at. The big cities use them. They use them in public demonstrations. I see Ms. Budis even shaking her head there. So instead of having 2 bylaw officers, you could have one guy with a bullhorn. He doesn't even have to get out of his car. Just drive by. It says enforcement on the car, and the crowds move. Just tell them that they're going to get a big fine if they don't move.
Member Columbus, I just was wondering if there's one thing that I might be able to task yourself and Member Van Passen. Is there a magic number for the farming community? Is it 6? Is it 7? Like what is the number, so that then we know what that target is looking like. What is the number that we're striving for?
Well, there really, in my opinion, there is no magic number. It just depends on the size of the operation. So it was started at 3, so they felt if you could increase it to 6 would be beneficial to quite a large number of smaller farm operators. It may not help the really large farm operators, but it still is some allowance to improve the efficiency of the labor force.
I guess it's just, I mean, we don't really know, well, I haven't heard anyway, what the battle is, because the way that I read the filings, I think it was, are they looking for, the current federal standards, or, is it somewhere in between what we have now and what that is?
I really can't answer that unless we had all the numbers of what the farm operations, how many.
Maybe for the next Board of Health, that might be, the next starting.
It would take some study of the statistics that the health department has.
Thank you, Madam Chair. I think Councillor Columbus has said it right. There is, and it's something I've argued for years, like if federal government has one standard, the province has another standard, and we've got another standard, it does make it awful confusing. So I think the ag community is more than happy to go with whatever that federal standard that I think a lot of the other jurisdictions are using. Another argument to be made is just the fact that it's a hard and fast number, and the logic has been played out over and over, but because one of the original sort of complaints was I have a trailer that's approved for 4 workers, I'm allowed to put 3 people in there. I also have a bunkhouse that's approved for 40 workers, but I'm still only allowed to put 3 workers in there. But look how many square feet and how many cubic feet and how much space I have. How does that make sense? Here they're crowded, here they're not. So, they'd be looking or willing to look at options of, increasing the standards on so many square feet per person, so many cubic feet per person, so the number of washrooms, or number of persons per washroom, or vice versa. Number of exits, are there other factors that you can look at that ensures the safety of the workers, ensures the safety of the community, but it does allow you to get a little better use out of the facilities that you already have. But, just to be, one of the other arguments is just that we're at a disadvantage to our neighbors next door in Brant and next door in Oxford and next door in Elgin.
I don't disagree with you.
Yeah.
Was just asking for if there was something then that, they're just curious if there was a number that had been floated around in the agricultural community. It was just more of a curiosity. There's one motion we just need to take care of for some housekeeping, which was the discussion on.
Thank you, Madam Chair. I'm sorry, I could have added that. That was the number of 6 to 7 when, some time ago I emailed Dr. Nissathuri. That was based on about, I think, 7 or 8 contacts I had with farmers who said that 6 or 7 would be a much more manageable number. And that's where I came up with that number.
Through the chair, we can take it as direction. We're meeting at the Ag Committee, and maybe the Ag Committee could formalize what their standing is. The complaint that was, or the appeal that was filed was clear with what they had stated, but maybe it would be better to get direction from the Agricultural Committee on what exactly they would be looking for.
Okay, so just the housekeeping matter with Ms. Plum's correspondence reads as follows. The clerk erred and allowed a late piece of correspondence into the changes to the agenda package. The communication includes language the clerk considers inconsistent with Section 8.4 of the procedural bylaw. The clerk has asked me to request the Board of Health to pass a motion reversing their decision to add to the agenda and receive the correspondence from Andrea Plum and not to be accepted on the agenda. I need a mover and a seconder. Moved by Councillor Taylor, seconded by Councillor Huffman. All those in favor? Opposed? Okay, and that's carried, and, oh,
That, earlier we had discussed that that would be coming back on June 30th, right? Just to make sure.
yes.
Okay, thanks.
And the second part is that in light of this new information from the county clerk, the Board of Health reversed their decision, I'm sorry, there was a second part here, that in light of the new information from the county clerk, the Board of Health reversed their decision to receive the correspondence of Andrea Plum for information, that the correspondence of Andrea Plum not be permitted on the agenda of the Board of Health upon the advice of the county clerk. Mover and a seconder, just for that last piece. That was all, I guess, to be included in there, Taylor and Michelle. All those in favor? And that's carried. Opposed? Okay, that's carried. Finally, a motion moved by Member Michelli and seconded by Member Columbus that bylaw 2020-06BH being a bylaw to confirm the proceedings of the Board of Health for the Haldeman Norfolk Health Unit at this Board of Health meeting held on the 9th of June 2020 be approved, signed by the Mayor and Clerk, and affixed with the corporate seal. All those in favor? And that's carried. And finally, that the special Board of Health meeting for Friday, June 19th, 2020 be adjourned at 7:30 p.m. All those in favor, moved by Member Huffman, seconded by Member Michelli. All those in favor? Carried.